If you work in healthcare, your English is not just important, it's critical. The difference between almost correct and fully clear can affect patient care, teamwork, and your professional confidence. You're very welcome to Learning English Pro, the home of medical English on YouTube. I'm Ger, your dedicated online, CELTA-qualified English teacher. In this masterclass, you're going to learn medical English across 16 focus lessons, covering vocabulary, real communication, and professional language used in healthcare settings. This course is structured into 4 modules: Foundations of Medical English, Medical Specialties, Healthcare Roles and Clinical Practice, and Patient and Professional Communication. All of these will help you build your English step by step, just like a real English course. And if you want to go deeper, I've created a complete study pack for this masterclass. It's great value. It includes 16 downloadable guides, one for each lesson in this video, with vocabulary, phrase banks, and additional practice content. You can get the full pack in my YouTube store for just $19.99, which is a huge saving compared to buying the guides individually. The link for everything is in the video description. And if you're a student member of the channel, you already have access to all of these guides. Head over to the membership tab where you can pick them up right now. So let's begin with our first module, Foundations of Medical English. Think you know medical English? If you don't know these 50 medical English abbreviations, you could miss vital patient information, and fast. Hi, I'm Ger and welcome to Learning English Pro, the home of medical English on YouTube. Today we're diving into 50 of the most common medical abbreviations you'll find in any English language hospital or clinic. This lesson is great for nurses, doctors, or anyone working in a healthcare setting. We'll cover 10 essential categories to really get you started on understanding just a few of the thousands of abbreviations you'll find in medical English. And if you want more lessons on medical abbreviations, let me know in the comments. Each of the 50 abbreviations we'll cover will come with an explainer and a real example sentence to help you use the term confidently. There's a lot to take in here, so come back and test yourself anytime. And don't forget to like, subscribe, and share it with your healthcare colleagues. For my amazing student members, head over to the membership tab for your copy of the full guide. It has all the learning content from this lesson, plus a huge glossary of 100 terms and additional exercises to boost your knowledge. If you're not a student member, you can join right now. The link to join is in the video description. The guide for this lesson is also available in my YouTube store. Everything is linked in the description. Okay, that's enough business. Let's get down to our abbreviations. If you really want to use abbreviations appropriately, listen up. Some abbreviations in medicine are only written in notes or charts. Some are spoken out loud in hospitals or clinics, and many are used both ways. So, as we go through the list, I'll tell you whether each abbreviation is typically written, spoken, or both, and I'll highlight that clearly for every single one of them. Now, how I pronounce them in the example sentence depends on how they're actually used in conversation. If the abbreviation is usually said as the full word, I'll say the full word. So for the abbreviation or X, you'll hear me say, the doctor wrote a prescription for antibiotics. But for something normally spoken as the abbreviation, like CPR, I'll say, the patient collapsed and CPR was initiated immediately. This way, you'll hear what native speakers would actually say, not just what's written down. If you're confused, pick up a copy of the guide. It's all laid out very clearly. Now let's jump into our first category, which is vital signs and monitoring. Our first abbreviation is BP, which stands for blood pressure. This is used in both spoken and written English. It means the force of your blood pushing against the walls of your arteries. Let's take a look at our example sentence. The patient's BP is dangerously low at 80/50. Our next abbreviation is HR, or heart rate, and this means the number of heartbeats per minute. HR can be used in both spoken and written English. Our example sentence is, Monitor the HR and report any changes above 100 BPM. BPM is another abbreviation meaning beats per minute. Let's move on to or respiratory rate. This relates to the number of breaths a person takes per minute, and we can use or in spoken and written English. Our example sentences: his or increased to 26 after the procedure. Our fourth abbreviation is written only. It is written as SpO2, and it refers to oxygen saturation. Oxygen saturation refers to the percentage of oxygen in the blood. Let's take a look at our example sentence. Her oxygen saturation dropped to 91%, so we began oxygen therapy. And abbreviation number 5 is our shortest abbreviation in our list, T for temperature. And of course, temperature relates to the body's internal heat, usually measured in Celsius or Fahrenheit. We can use the T abbreviation in both spoken and written English. Our example sentences: patient's T is 38.6 degrees Celsius, indicating a possible infection. So, well done. Those first 5 abbreviations are essential for assessing patient stability. They're critical English for every member of the medical team. Let's have a quick quiz question. Which abbreviation refers to the percentage of oxygen in the blood? The correct answer is number 4. Well done if you got that right. Okay, let's move on. But before we do, if you haven't subscribed yet, click the button to stay updated on all my medical English lessons. The next topic is a really interesting one. It relates to body systems and assessments. Our first abbreviation is CNS. This refers to the central nervous system, and this abbreviation is both written and spoken. We're checking for signs of CNS depression after the overdose. Next up, number 7, we have CVS, which relates to the cardiovascular system. This is the heart and blood vessels working together. And again, CVS can be used in written and spoken English. He has a history of CVS disease, so monitor his vitals closely. Number 8 is GI, or gastrointestinal, relating to the digestive system. Again, GI can be said or written in English. The patient reports GI discomfort after eating. Our 9th abbreviation is GU, or genitourinary, which refers to the urinary or genital organs. A GU infection is suspected due to the presence of blood in the urine. So here you can see it's written and spoken. Our 10th abbreviation is MSK, or musculoskeletal. This abbreviation refers to muscles, bones, and joints, and again, it can be written or spoken. She has MSK pain following a workplace injury. Great job! These abbreviations help you speak clearly about different systems in the human body, super important when communicating across departments. Let's have a quick quiz. Which abbreviation is used when referring to the heart and blood vessels? The correct answer is CVS. If you got that right, give yourself a pat on the back. If you're finding these abbreviations challenging, don't worry, they are very tricky. But if you download the guide that's available for my student members or on my YouTube store, you'll give yourself a really good boost in this area of medical English. Okay, next up, we're covering abbreviations relating to medical history and patient notes. Our first abbreviation in this category is written only. HO, or history of. This refers to a patient's past conditions. Our example sentences: patient has a history of hypertension and diabetes. And next we have DC, which can mean either discharge or discontinue. This abbreviation can be written or spoken, and depending on the context, means to release or stop something. Our example sentences: the patient was DC'd yesterday afternoon. Next, we have NKA, or no known allergies. This indicates no allergies have been reported by a patient. This is a written abbreviation. Our example sentence is, she's no known allergies, so we proceeded with the standard antibiotic. Also written is NKDA, no known drug allergies. This specifically states no medication allergies for a patient. Our example sentence is, no known drug allergies, administered amoxicillin. Next up, we have SOB, which means shortness of breath or difficulty breathing. SOB is used in written and spoken English. Patient presented to the ED with acute SOB. You're doing amazing work. These kind of abbreviations you'll see constantly in patient records. Here's your next quiz. What does NKA stand for? The correct answer is no known allergies. Nicely done if you got that right. If you're finding this lesson helpful, make sure to click the like button and share it with a colleague. Maybe watch it together and have a chat about all the different abbreviations you're learning. Our fourth section covers abbreviations used for tests and investigations. And all the abbreviations in this category can be both spoken and written. And first up, we have CBC. This relates to the complete blood count, a test that evaluates overall health and detects disorders. The CBC showed elevated white blood cells. CMP, or Comprehensive Metabolic Panel, is of course the blood test measuring glucose, electrolytes and more. We ran a CMP to check her kidney and liver function. We also have the abbreviation CXR, or a chest X-ray. And of course, this is an image of a chest to check lungs and heart. A CXR was ordered to rule out pneumonia. MRI, as an abbreviation, stands for magnetic resonance imaging. This is a scan to produce a detailed image of organs and tissues. Our example sentence is, an MRI was scheduled for the patient's lower spine. Our 20th abbreviation is ECG, or EKG. This refers to an electrocardiogram, which measures the heart's electrical activity. The EKG showed signs of atrial fibrillation. Brilliant! These abbreviations are vital for interpreting results and ordering tests. Let's check your knowledge. Which abbreviation refers to a test that checks your blood for white and red cells? Did you get it? The correct answer is CBC. Great work. Don't forget, you can pick up a guide for this lesson as a student member on my channel. Student members get access to every PDF I've ever written for this channel and every new one that comes along. There's also 300 members-only videos on my channel. That's 300 English lessons waiting for you right now. The link to join is in the video description. Our next topic focuses on medication and prescriptions. First up, we have RX, a written abbreviation. This means prescription, a written order for medicine. The doctor wrote a prescription for antibiotics. PRN is our next abbreviation, and it can be both written and spoken, and it means as needed, a medication given only when necessary. Morphine, 5 mg PRN for pain. BID stands for twice a day. It's from Latin and this one is written only. Take this tablet twice a day with food. Similarly, we have TID, also from Latin. This means 3 times a day, and this one's also written. Our example sentences: prescribed 250 mg 3 times a day for 5 days. Our final abbreviation in this category is IV, or intravenous. This is spoken and written. And this means that something like a medication is delivered directly into a vein. Our example sentences: administered IV fluids after dehydration. Wow, that's another powerful batch of abbreviations you've learned, especially for anyone handling medication. These abbreviations help keep drug instructions short but clear. Are you ready for quiz time? Which abbreviation means a medication taken 3 times a day? The correct answer is TID. Well done. Have any of the abbreviations surprised you so far? Have you seen one before and now you really understand what it means? Let me know in the comments below. I'd love to hear from you. Our journey through medical abbreviations takes us to emergency terms. And all the abbreviations in this section can be both written and spoken in English. And first up, we have CPR, or cardiopulmonary resuscitation, and of course refers to a life-saving procedure for cardiac arrest. The patient collapsed and CPR was initiated immediately. AED. This refers to an automated external defibrillator, a portable device that delivers an electric shock to restart the heart. We used the AED before the ambulance arrived. LOC stands for loss of consciousness. This means when someone becomes unresponsive. He experienced LOC for approximately 30 seconds. Our next abbreviation is one you'll always hear in the movies or in TV shows. STAT. This means immediately. It's a command for urgent action or results. We need a STAT ECG. He's not stabilizing. Our 30th abbreviation is BLS, or Basic Life Support, a level of emergency care for unresponsive or non-breathing patients. All healthcare workers are required to maintain valid BLS certification. Well done, those last 5 abbreviations are really crucial in emergency medicine. They are critical English for every member of the team. Let's have a quick question. Which abbreviation is used when a procedure or result is needed urgently? And yes, the correct answer is STAT. Well done if you got that right. Let's move on to category number 7, nursing and monitoring. And all the abbreviations in this section, apart from the last one, are both written and spoken. ADL refers to activities of daily living. This means basic personal care tasks like eating or bathing. She needs assistance with all ADLs following her stroke. INO refers to intake and output. This is the measurement of fluids consumed and excreted. Our example sentences: please document INO every shift for this patient. NPO is nothing by mouth. This is a restriction on eating or drinking. The patient is NPO ahead of surgery. VS means vital signs. These are key indicators of patient's health. Our example phrase is: record the VS every 4 hours post-op. And our last abbreviation in this category is written only, Q4H, which means every 4 hours. This is a frequency of checks or for medication. Vitals must be taken every 4 hours on this ward. Excellent work, well done. Those abbreviations appear constantly in nursing notes and charts, so getting familiar with them is a must. Quick quiz. What does NPO mean? Did you get it right? The correct answer is nothing by mouth. Great job if you remember that. If you're finding this lesson useful, make sure to hit the subscribe button. It really helps the channel. Next up, let's go over abbreviations related to labs and fluids. And in this section, all the abbreviations are written only, except for the last one. First up, we have Na+, which stands for sodium, an important electrolyte in the blood. The sodium level was slightly elevated after dehydration. Next, we have a K+, which means potassium, which is another key electrolyte for nerve and muscle function. Low potassium can lead to arrhythmias. Watch those levels closely. BUN stands for blood urea nitrogen. This measures kidney function. The blood urea nitrogen result suggests reduced kidney filtration. The abbreviation CR stands for creatinine, another key indicator of kidney health. Her creatinine levels have improved since starting treatment. Next up we have IVF, which stands for intravenous fluids. These are fluids delivered directly into a vein. We started IVF to stabilize her after blood loss. Now just note, IVF on the street is commonly known to refer to in vitro fertilization. So just make sure you understand the context in which it's been said. Well done, brilliant stuff. All of these terms are often seen in lab reports and fluid balance charts. They're essential for understanding patient hydration and kidney function. Okay, it's quiz time. Which abbreviation refers to fluids given through a vein? And yes, it's the last one we just had, IVF. Excellent if you caught that. Well, we are soaring through all of our abbreviations. Well done for sticking around this far. We're at our final 10. And our next category is category 9, admissions and transfers. And all of the abbreviations in this section can be both written and spoken in English. ED refers to the emergency department, the hospital area for urgent care. The patient was brought to the ED with chest pain. ICU. This stands for Intensive Care Unit, a unit for critically ill patients. He's being transferred to ICU for closer monitoring. L&D stands for Labour and Delivery, the unit where childbirth occurs. She was admitted to L&D at 38 weeks. Our next abbreviation is OBS. So we don't say OBS here, we say OBS, which is short for observation, a period of monitoring without full admission. He was kept in OBS overnight for further evaluation. Abbreviation number 45 is AMA, Against Medical Advice. This is when a patient leaves the hospital without approval. She signed an AMA form and left before discharge. You're doing so well. These abbreviations help staff coordinate where patients are and how their care is managed. Let's try another quiz. Which abbreviation is used for patients who leave hospital before being discharged by a doctor? And yes, the correct answer is AMA. Give yourself a clap on the back. Our final category includes some very important terms used in legal, safety, and communication settings. And all of these terms can be used in both written and spoken English, except the very last one. DNR stands for Do Not Resuscitate. This is a legal order to not perform CPR. The chart includes a signed DNR order. HIPAA is an abbreviation which stands for Health Insurance Portability and Accountability Act. This is a US law protecting patient privacy. Sharing patient info without consent breaches HIPAA. SBAR stands for Situation, Background, Assessment and Recommendation. This is a type of communication framework for handovers. Use SBAR when calling the doctor with concern. PPE. This stands for Personal Protective Equipment. This refers to all the safety gear like gloves, masks and gowns worn in a hospital setting. Always wear PPE when dealing with infectious patients. And our final and 50th abbreviation is QA, which stands for Quality Assurance. And this abbreviation is generally written. It means a system to maintain healthcare standards. The quality assurance audit revealed gaps in medication tracking. Well done. You made it to the end of all 50 abbreviations. You have done absolutely fantastic. Do you work in healthcare and want to sound more confident when talking about nutrition? Whether you're a dietitian, nurse, doctor, or a healthcare student, today's lesson will give you the essential English vocabulary you need. Welcome to Learning English Pro, the home of medical English on YouTube. I'm Jer, your intrepid English teacher, bringing you professional English you can use right in your workplace. Today's topic is a special request from one of my student members, a full lesson on nutrition vocabulary designed for dietitians, nutritionists, and healthcare workers like doctors and nurses. We're going to cover the top 15 essential terms you need for nutrition and dietetics to help you communicate clearly and confidently with both colleagues and patients. We'll run through pronunciation, definition, and I'll even give you an example phrase for each term you can use right away. And if this is your first time with the channel, make sure to drop a like and subscribe for more videos. Alright, let's dive straight into this nutrition English lesson and boost your professional medical vocabulary. Our first important term is macronutrients. Repeat after me. Macronutrients. Let's take a look at our definition. Macronutrients are the essential nutrients the body requires in large quantities to function properly. These include carbohydrates for energy, protein for growth and repair, and fats for long-term energy storage and hormone regulation. Let's have a look at our first example sentence. A balanced diet includes all three macronutrients: carbohydrates, proteins, and fats. Okay, well done. Let's move on to our second term, micronutrients. Micronutrients. Micronutrients are needed in smaller amounts, such as vitamins and minerals. They play critical roles in immunity, bone health, blood function, and many metabolic processes. Our example sentences: leafy greens are rich in micronutrients such as vitamin K and iron. Let's fire ahead to our next term, which is metabolism. Repeat after me. Metabolism. The metabolism is the set of chemical processes through which the body converts food into usable energy. It also regulates cell activity and supports vital functions like breathing, circulation, and temperature control. Regular exercise can boost your metabolism and support weight management. Let's move on to our fourth term, dietary fiber. Dietary fiber. Dietary fiber is a type of carbohydrate found in plant foods that cannot be digested by the human body, and this promotes bowel regularity, controlling blood sugar, and supporting gut health. Dietary fiber is essential for maintaining healthy bowel movements. Next up, we have an acronym, BMI. This stands for Body Mass Index. Body Mass Index. And it is a widely used tool that calculates a number from a person's height and weight to provide an estimate of body fat and assess whether weight falls within a healthy range. Let's check out our example. Your BMI falls within the healthy range, but we should also assess muscle mass. It's time for term number 6. Malnutrition. Malnutrition. Malnutrition is a condition resulting from either too little or too much nutrient intake, which can lead to undernutrition, deficiencies, or health problems associated with excessive calories and poor diet quality. Malnutrition remains a major public health issue in many developing countries. Portion size. Portion size. This term relates to the specific amount of food or drink served to one individual at a single eating occasion, often compared with recommended serving sizes for health management. Reducing your portion size is often more effective than removing entire food groups. Let's move on. Nutrient dense. Repeat after me. Nutrient dense. This term is a description of foods that provide a high concentration of vitamins, minerals, and other beneficial compounds relative to their calorie content, supporting overall health without excess energy intake. Berries are nutrient dense and make a healthy snack. Our next term is dietary guidelines. Dietary guidelines. Dietary guidelines are evidence-based recommendations issued by health authorities that outline optimal eating patterns and nutritional practices to reduce disease risk and promote long-term health. Let's have a look at our example sentence. Dietitians follow dietary guidelines to help patients make better food choices. Can you believe we're already at term number 10? Allergens. Repeat after me. Allergens. And let's check out our definition. Allergens are substances found in certain foods that trigger immune responses in sensitive individuals, ranging from mild reactions to severe and life-threatening conditions. Our example sentences: allergens like peanuts and shellfish must be clearly labelled on packaging. Next up, our term is glycemic index. Glycemic index. And this is commonly referred to as GI. So what does this term mean? It is a scale that ranks foods based on how quickly they raise blood sugar after consumption, often used in managing diabetes and planning diets for steady energy release. Low GI foods are better choices for patients with diabetes. Term number 12, and we're coming near the end of our list. Hydration. Repeat after me. Hydration. Hydration is the maintenance of proper fluid balance in the body, which is vital for circulation, temperature regulation, waste removal, and cellular health. Proper hydration is essential for kidney function and overall health. Let's move on. Saturated fats. Saturated fats. These are a type of fat primarily found in animal products and some processed foods. They're associated with elevated cholesterol levels and increased risk of cardiovascular disease when consumed in high amounts. Try to limit your intake of saturated fats by choosing lean cuts of meat. And now it's time for our penultimate term. Supplementation. Supplementation. Supplementation is the practice of taking additional vitamins, minerals, or other nutrients beyond the normal diet to correct deficiencies, prevent illness, or support specific health conditions. Vitamin D supplementation is recommended during winter months. And now for our final and 15th term. Well done if you got this far. Clinical dietetics. Clinical dietetics. This is a specialized branch of dietetics that applies nutritional science in medical settings to diagnose, treat and manage diseases through tailored diet and nutrition plans. Let's check out our final example sentence. She specializes in clinical dietetics, working mainly with diabetic patients. And that's it. Now you know the 15 essential nutrition and dietetics terms every healthcare professional should master. Well done. Using these words confidently will help you communicate better with your colleagues, patients, and other healthcare professionals. In healthcare, you don't just need to know what vitamins do, you need to know how to talk about them clearly and professionally with both patients and colleagues. Hi, I'm Jer from Learning English Pro, and on this channel, I help healthcare professionals build the English they need for real clinical communication. In this lesson, I'm going to guide you through all 13 essential vitamins, their medical names, what they do in the body, and the most common food sources, using clear, practical medical English you can use at work. If you'd like the full structured version of this lesson, the complete guide, Vitamins in English, is available now in my YouTube store. And it's also free for student members in the membership tab. So head over there right now and pick up your copy if you're a student member. Everything is linked below so you can access it anytime. So let's get started with our lesson. And first up, we have a pronunciation issue with this term vitamin. Now I'm saying it in the British English. This is how it is pronounced there, vitamin. However, in American English, it is pronounced vitamin. Vitamin. For the purpose of this lesson, I'll be sticking with the British English pronunciation. Okay, so let's start with vitamin A and how we describe its role in vision and immune health in professional English. So with vitamin A, it has a scientific or a medical name. In its active form, it's known as retinol. And as a provitamin, it's known as beta-carotene. So let's move on to its usage and its function in the body. Vitamin A is essential for vision, especially night vision, immune function, epithelial cell maintenance, and skin health. So, what are the most common food sources for vitamin A? They include carrots, liver, and spinach. Let's move on to our second vitamin, vitamin B1. Vitamin B1 is known scientifically or medically as thiamine. And what is it used for? It is required for carbohydrate metabolism and normal nerve conduction. Deficiency can cause beriberi or Wernicke-Korsakoff syndrome. The most common foods you can get vitamin B1 from are whole grains, pork, and legumes. Next up, we are on to vitamin B2, also known as riboflavin. Riboflavin. Riboflavin, or vitamin V2, is involved in cellular energy production and redox reactions, and it also supports skin and eye health. Common foods associated with vitamin B2 are milk, eggs, and almonds. Our fourth vitamin is vitamin B3, niacin, also referred to as nicotinic acid or nicotinamide. This supports DNA repair, energy metabolism, and nervous system function. Vitamin B3 can be found in poultry, tuna, or peanuts. Staying in the vitamin B family, we're on to vitamin B5. Medically or scientifically, this is known as pantothenic acid. Pantothenic acid. It is necessary for synthesis of coenzyme A, which is vital for fatty acid metabolism and hormone production. Now, what foods can you get this from? It's most common in eggs, mushrooms, and avocados. Vitamin number 6 is vitamin B6. This is also known as pyridoxine. This vitamin plays a role in amino acid metabolism, neurotransmitter synthesis, and hemoglobin formation. It's most common in bananas, chickpeas, and poultry. Next up, for number 7, we have vitamin B7, and this is also known as biotin. Biotin supports fatty acid synthesis, glucose metabolism, and healthy hair and skin. It's most commonly found in cooked eggs, nuts, and seeds. If you're looking to dive more into the subject of vitamins and really boost your English learning, check out my guide, Vitamins in English. It's available right now on the YouTube store for just $4.99. It contains a really interesting article I wrote on the history of vitamins. Then, following that, you'll get a page for each vitamin with lots of additional information you won't get in this video. Moving on, you'll also get access to my English glossary, which contains lots of additional words that are useful around the subject of vitamins. You can pick it up in my YouTube store right now. The link is in the description. And if you're one of my lovely student members, head over to the membership tab. You can pick up your free copy as part of your membership. Now let's get back to our lesson. Our 8th vitamin is vitamin B9, also known as folate, and in its synthetic form, it's called folic acid. This is essential for DNA synthesis, cell division, and prevention of neural tube defects in pregnancy. It can be found in leafy greens, lentils, and fortified cereals. Let's move on to our next vitamin, vitamin B12. This vitamin can also be referred to as cobalamin. It is required for red blood cell formation, neurological function, and DNA synthesis. It's most commonly found in meat, dairy products, and fish. Vitamin number 10, and we're on to vitamin C. Vitamin C is also known as ascorbic acid, and it's important for collagen synthesis, wound healing, immune support, and iron absorption. It's most commonly found in citrus fruits, strawberries, and bell peppers. If you're enjoying this lesson, make sure and check out my student membership. As I mentioned, you'll get the guide for this lesson and you'll get access to my complete PDF library where I publish a new guide for every lesson, and you'll get access to over 300 videos in my membership-only collection. Click the link in the description below. Membership is $4.99 a month and really great value. Now we're down to our final 3 vitamins. Our 11th vitamin is vitamin D. And we have 2 versions of this vitamin D. Vitamin D3 is known as cholecalciferol, and vitamin D2 is known as ergocalciferol. These vitamins regulate calcium and phosphate balance, supporting bone mineralization and immune function. The foods you'll get them from are oily fish, egg yolks, and fortified milk. Our penultimate vitamin is vitamin E. In the medical and scientific world, it's known as alpha-tocopherol. Vitamin E acts as a powerful antioxidant, protecting cell membranes from oxidative damage. It's most prevalent in sunflower seeds, almonds, and vegetable oils. And now it's time for our final vitamin, vitamin K. Vitamin K1 is known as phylloquinone, and vitamin K2 is known as menaquinone. Vitamin K is essential for blood coagulation and the activation of clotting factors. You'll find vitamin K in leafy greens, broccoli, and fermented foods. And that brings us to the end of our full overview of the 13 essential vitamins in medical English. Well done for getting through all of them. If you want to review everything we've covered today, including the medical terminology, functions, and food sources, you can get the full Vitamins in English guide from my YouTube store, or access it instantly if you're a student member on the channel. If this lesson helped you, give it a like and let me know in the comments which vitamin do you talk about most in your work with patients or colleagues. And make sure to subscribe to Learning English Pro for more medical and professional English lessons every week. If you work in healthcare, especially with heart patients, these 15 essential cardiology terms will help you speak clearly and confidently with colleagues and patients. Today, I'll explain each word in simple language and give you natural example phrases that you can use right away in a hospital or clinic setting. Welcome to Learning English Pro. I'm Jer, and here we focus on English you really need for your professional life. This lesson is perfect for nurses, doctors, medical students, and anyone working in healthcare who wants to improve their medical English. Make sure to drop a like and subscribe for more medical English lessons. Okay, let's get started with our first term. Cardiac arrest. Repeat after me. Cardiac arrest. So, a cardiac arrest is a sudden stop in heart function, often causing the patient to collapse and lose consciousness. Let's take a look at our example phrase. The patient went into cardiac arrest and we started CPR immediately. Term number 2, arrhythmia. Repeat after me. Arrhythmia. This is an irregular heartbeat, too fast or too slow or uneven. Our sample phrase is, we need to monitor her arrhythmia overnight with an ECG. Let's move on to our third term, tachycardia. Tachycardia. Tachycardia is a heartbeat that is too fast, usually over 100 beats per minute in adults. Let's check out our phrase. The monitor shows tachycardia. Let's check if the patient is in distress. Our next phrase is the opposite of tachycardia, bradycardia. Bradycardia. And this means a heartbeat that is too slow, usually under 60 beats per minute in adults. His bradycardia could be due to his medication. Call the doctor to review the dose. An important cardiology term is myocardial infarction. Let's hear that one more time. Myocardial infarction. A myocardial infarction is the medical term for a heart attack caused by blocked blood flow to the heart muscle. Let's check out our example phrase. The ECG confirms a myocardial infarction. Prepare the patient for urgent intervention. We're already on term number 6, angina. Repeat after me. Angina. Angina is chest pain caused by reduced blood flow to the heart. If you feel angina again, press the call button immediately. Term number 7 is heart murmur. Heart murmur. A heart murmur is an unusual sound in the heartbeat, often caused by a valve problem. The doctor detected a heart murmur during your examination. Next up, we have a longer term, congestive heart failure. Repeat after me, congestive heart failure. This is a condition where the heart cannot pump blood effectively, leading to fluid buildup. Her swollen ankles are a sign of worsening congestive heart failure. Term number 9 is a bit tricky. Atherosclerosis. Let's hear that one more time. Atherosclerosis. This condition is a hardening and narrowing of the arteries due to plaque buildup. Let's check out our example sentence. Atherosclerosis increases the risk of heart attack and stroke. We are getting through these terms really fast. Here's term number 10. Palpitations. Palpitations. Palpitations are the feeling that your heart is racing, pounding, or skipping beats. Tell me if you experience palpitations during the stress test. Next up is ventricles. Repeat after me. Ventricles. These are the two lower chambers of the heart that pump blood to the body and lungs. Let's check out our example. The left ventricle pumps oxygen-rich blood to the whole body. We also have the atria. Atria. The atria are the two upper chambers of the heart that receive blood from the body and lungs. The atria fill with blood before it moves into the ventricles. Term number 13. Blood pressure. Blood pressure. This is the force of blood pushing against artery walls as the heart pumps. The nurse will check your blood pressure every 2 hours. Our penultimate term is pulse rate. Repeat after me. Pulse rate. A pulse rate is the number of heartbeats per minute. His pulse rate is 110, which is higher than normal. Our final English medical term for this lesson is electrocardiogram. Electrocardiogram. This can also be referred to as an ECG or an EKG. And this, of course, is a test that records the electrical activity of the heart. Let's check out our final example phrase. We'll do an ECG to check for any irregular heart rhythms. And there we have it. Well done. You've just learned 15 essential medical English terms relating to the heart in cardiology. If you work in healthcare, you know how important it is to describe skin conditions clearly and professionally. In this lesson, we're learning 15 essential dermatology terms in English, the words and phrases doctors, nurses, and healthcare professionals use every day when talking about rashes, skin treatments, and patient care. I'll explain each term clearly with real-world examples and clear professional pronunciation to help you sound confident when speaking with patients or colleagues. Welcome to Learning English Pro. I'm Jer, and here we focus on the English you need for your job. Whether you're a nurse, a doctor, a medical student, or preparing for the OET exam, this lesson will help you master the language of skin and dermatology. Okay, let's get started with our first dermatology term. And first up, we have rash. Repeat the word after me. Rash. A rash is a change in skin appearance, often red, itchy, or irritated. Okay, let's take a look at our example phrase. The patient developed a rash after taking the new medication. Let's move on to our second term, lesion. Repeat after me. Lesion. Let's check out our definition. A lesion is an area of abnormal tissue, such as a sore, a lump, or a wound. The dermatologist examined the lesion under a magnifier. It's time for term number 3, biopsy. Biopsy. A biopsy is a small sample of skin taken for laboratory testing. Let's check out our example phrase. We'll perform a biopsy to rule out skin cancer. Let's move on to eczema. Repeat after me. Eczema. Eczema is a chronic condition causing dry, itchy, and inflamed skin. Eczema can worsen in cold, dry weather. Let's move on to our fifth term, psoriasis. Notice here the P is silent. Psoriasis. Psoriasis is a skin condition that causes thick, scaly patches of skin. Psoriasis often appears on the elbows, knees, or scalp. Next up, we have acne. Acne. Acne is a condition where hair follicles become clogged with oil and dead skin cells. Teenage acne is common due to hormonal changes. Term number 7, mole. Repeat after me. Mole. A mole is a small, usually brown spot on the skin caused by pigment cells. Let's check out our example. The mole has changed shape and needs to be checked. If you're enjoying this lesson on medical English related to dermatology, make sure and check out the guide that comes with this lesson. It's available to my student members as part of your membership. Head over to the membership tab now to pick up your copy. It's also available on my YouTube store for just $1.99. It contains all content from the lesson and an additional bonus glossary and exercise to really help you boost your English in this specialized area of medical English. Okay, time to get back to the lesson. Term number 8, melanoma. Repeat after me. Melanoma. This is a serious form of skin cancer that develops from pigment cells. Let's check out our example. Early detection of melanoma greatly improves outcomes. Term number 9, dermatitis. Dermatitis. Dermatitis is an inflammation of the skin caused by irritation or allergic reaction. Contact dermatitis can occur after touching certain chemicals. Term number 10. Well done for getting this far. Itching. Itching. We also have the term pruritus. Pruritus. These words relate to an uncomfortable sensation that makes you want to scratch. Let's check out our example. The patient complained of severe itching on both arms. Our next term is scab. Scab. A scab is a dry crust that forms over a healing wound. Do not remove the scab. It protects the new skin underneath. Let's move on to blister. Blister. A blister is a small bubble on the skin filled with fluid, often from friction or burns. Let's check out our example. New shoes caused blisters on her heels. If you're enjoying this lesson, make sure to drop it a like and subscribe to Learning English Pro for lots more medical English. And now you can join me 6 days a week on my live streams, learn lots of useful English vocabulary, and join the fun with my live quiz. I look forward to chatting to you. Okay, we're down to our final 3 terms. Well done for getting this far. Term number 13 is pigmentation. Repeat after me. Pigmentation. Pigmentation is the natural color of the skin, which may darken or lighten due to conditions. Uneven pigmentation can result from sun exposure. Term number 14. Sunburn. Repeat after me. Sunburn. Sunburn is skin damage caused by overexposure to UV rays. He was treated for sunburn after spending the day at the beach. And now it's time for our final term. Scar. Scar. A scar is a mark left on the skin after a wound has healed. Let's check out our final example sentence. The surgery left only a small scar. Well done! You've just learned 15 essential dermatology terms that will help you communicate with confidence in hospitals, clinics, and patient consultations. Remember, the more you practice these words, the easier it becomes to describe symptoms, discuss treatments, and explain care instructions naturally in English. If you work in healthcare, especially in hospitals or clinics where imaging is an essential part of diagnosis, these 15 radiology terms will help you speak clearly and confidently with both colleagues and patients. In today's lesson, I'll explain each word in simple language and give you natural example phrases you can use right away in your professional practice. Welcome to Learning English Pro, the home of medical English on YouTube. I'm Jer, and here we focus on English you really need for your professional life. This lesson is perfect for nurses, doctors, medical students, and anyone working in healthcare who wants to improve their medical English. Okay, let's get started on our first term, and let's start with a few basics. X-ray. Repeat after me. X-ray. And of course, an X-ray is an imaging test that uses radiation to view bones and some organs. Let's check out our example phrase. We'll order a chest X-ray to check for pneumonia. Moving on to term number 2. It's a CT scan. CT scan. This is a detailed imaging test using X-rays and computer processing. The CT scan showed a small bleed in the brain. Let's move on to MRI. MRI. MRI is a scan using magnets and radio waves to produce detailed images. The patient is scheduled for an MRI of the spine. Term number 4. Ultrasound. Ultrasound. Ultrasound is imaging that uses sound waves to see inside the body. We'll do an ultrasound to check the liver. We're already on term number 5. Contrast. Repeat after me. Contrast. Contrast is a substance used in imaging to make structures clearer. Let's take a look at our example sentence. The CT with contrast revealed a tumor in the kidney. Term number 6. Mammogram. Mammogram. A mammogram is a special X-ray used to detect breast abnormalities. Her mammogram came back normal this year. Let's move on to fluoroscopy. Fluoroscopy. Fluoroscopy is imaging that shows moving body parts in real time. Fluoroscopy was used to guide the catheter into place. Term number 8. Angiogram. Repeat after me. Angiogram. An angiogram is an imaging test of blood vessels, usually with contrast dye. Let's check out our example phrase. The angiogram showed narrowing of the coronary arteries. If you're enjoying this lesson and want to dive deeper into the words, check out the guide that comes with this lesson. It's available to my student members over on the membership tab right now, and you can join student membership with the link below. The guide is also available as a one-time download on my YouTube store for just $1.99, so check it out. Everything's linked in the video description. Let's move on to radiograph. Radiograph. A radiograph is the actual image produced by an X-ray. The radiograph confirms a fracture of the radius. Term number 10. PET scan. PET scan. A PET scan is an imaging test that shows metabolic activity using a radioactive tracer. The PET scan detected early cancer spread. Let's move on to radiologist. Radiologist. A radiologist is a doctor who interprets imaging tests. The radiologist will review the MRI and send a report. Term number 12. Interventional radiology. Interventional radiology. These are procedures using imaging to guide minimally invasive treatments. Let's check out our example. Interventional radiology placed a stent in the bile duct. Next up, we have radiation dose. Radiation dose. This is the amount of radiation a patient receives during imaging. We need to limit the radiation dose for pediatric patients. If you're enjoying this lesson on Medical English, make sure to drop a like, subscribe, and maybe share it with a colleague. And if you have a request for a Medical English lesson, let me know in the comments. I'd love to hear from you. We are down to our final 2 terms. Term number 14. Artifact. Artifact. An artifact is a false or misleading feature on an image caused by movement or equipment. The blurry spot is just an artifact, not a lesion. And now it's time for our final term. Portable X-ray. Portable X-ray. A portable X-ray is an X-ray machine that can be brought to the patient's bedside. Let's check out our final example sentence. We ordered a portable X-ray for the ICU patient. Great work today. You've just learned 15 essential radiology terms that will help you communicate more clearly with patients and colleagues in real hospital and clinic settings. Remember, these words become much easier to use when you practice them regularly. If you work in oncology or support cancer patients in any way, you already know this. The words you choose matter. One clear phrase can calm a patient, and one misunderstood term can create confusion in a moment when clarity is everything. Today, I'm going to teach you the essential English vocabulary you need to communicate confidently in oncology, professionally, compassionately, and clearly. Welcome back to Learning English Pro. I'm Ger, your CELTA qualified English teacher, and this is the home of Medical English on YouTube. Today's lesson is all about building the medical English skills you need for real hospital communication. Before we begin, this lesson comes with a beautifully designed Oncology English Vocabulary Guide available right now in my YouTube store. You'll find full definitions and example sentences for today's video, along with glossaries for chemotherapy, cancer types, and even a practice quiz. If you're a student member, the guide is already included in your membership. Just head over to the membership tab right now to download it instantly. Alright, let's jump in to our lesson. Let's build your confidence, your clarity, and your professionalism with 15 essential oncology terms every healthcare worker should know. Term number 1 is tumour. Now, we have differences in American and British English spelling, so please note this. Tumour. This is an abnormal growth of cells that might be benign or malignant. Now, we'll get into these terms in a little bit. Let's check out our example sentence. The scan shows a small tumour, and we'll need to run more tests to understand its behaviour. Term number 2 is malignant. Repeat after me. Malignant. Malignant describes cancerous cells that can grow quickly and spread to other parts of the body. Let's check out our example. The biopsy confirmed the mass is malignant, so we need to start treatment soon. Term number 3 is benign. Benign. The term benign means a non-cancerous growth that does not spread to other tissues. The results are reassuring. The tumour is benign. Term number 4 is metastasis. Metastasis. This relates to the spread of cancer cells from the original site to other parts of the body. Let's check out our example. We need to check if there's any sign of metastasis on the latest scan. Term number 5 is chemotherapy. Chemotherapy. And of course, chemotherapy is a treatment that uses powerful medications to destroy cancer cells. He'll begin chemotherapy next week, and we'll monitor his response closely. Term number 6. We also have radiotherapy. Repeat after me. Radiotherapy. Radiotherapy treatment is one that uses targeted radiation to destroy cancer cells or shrink tumours. The radiotherapy sessions will take place daily for 6 weeks. Term number 7 is a positive one. Remission. Remission. Remission is a period when cancer signs and symptoms reduce or disappear. Your scans show no active disease. This means you're in remission. If you're enjoying this lesson and want to pick up the guide, it's available right now in my YouTube store. It's full of lots of additional terms related to cancer and chemotherapy. It's super useful for healthcare workers. And if you're a member of my student membership, you can head over to the membership tab and pick up your copy right now. Let's move on to term number 8, relapse. Relapse. Relapse means when the cancer returns after a period of improvement or remission. Let's check out our example. We're concerned about a possible relapse, so we'll run additional tests. Term number 9, biopsy. Repeat after me. Biopsy. A biopsy is the removal of a small sample of tissue to examine for cancerous cells. A biopsy will give us the most accurate information about the type of cells present. Term number 10. Staging. Staging. Staging is the process of describing how advanced a cancer is based on tumor size, lymph node involvement, and spread. We'll complete the staging assessment before deciding on a treatment plan. Term number 11. Immunotherapy. Immunotherapy. Immunotherapy is a cancer treatment that helps the immune system recognize and attack cancer cells. Let's check out our example sentence. He may benefit from immunotherapy, depending on how the cancer responds. If you're enjoying this lesson on Medical English, make sure to subscribe to Learning English Pro, the home of medical and professional English. And check out my student membership. You'll get a PDF guide every time I publish a new video. As a student member, you'll also gain instant access to my complete library of PDF guides covering lots of lessons in medical and business English. There's so many perks with student membership. You'll get fast replies on your comments and your requests, and you'll also gain access to my video library of over 300 English lessons covering every possible topic. Let's get back to our lesson. We're almost finished. Term number 12 is palliative care. Repeat after me. Palliative care. Palliative care is supportive care focused on relieving symptoms and improving quality of life during serious illness. Let's check out our example sentence. Palliative care doesn't mean we're stopping treatment. It's about comfort and support. Term number 13. Lymph nodes. Lymph nodes. Lymph nodes are small glands that filter lymph fluid and can be affected by cancer spread. We'll check the lymph nodes to see if the cancer has spread beyond the original site. Let's move on to our second last term, prognosis. Prognosis. Prognosis is the expected development or outcome of an illness. It's too early to give a full prognosis, but the treatment plan looks promising. And now it's time for our final term, targeted therapy. Targeted therapy. This is a cancer treatment that blocks specific molecules involved in tumor growth. Let's check out our final example sentence. Targeted therapy is an option because the tumor carries a particular genetic marker. Well done for getting to the end of the list. That's your Oncology Vocabulary lesson for today. If you work in healthcare, you already know that psychology isn't just theory, it's language. The words you choose in a clinical setting can change how a patient understands themselves, their condition, and their treatment. Hi, I'm Jer, and this is Learning English Pro, the home of Medical English on YouTube. This is the channel where I help healthcare professionals, students, and international workers sound clear, confident, and professional in real clinical English. In today's lesson, we're focusing on clinical psychology English. I'm going to walk you through key psychological conditions and terms that are commonly identified during therapy sessions, assessments, and clinical interviews. I'll break down each term with a definition, and I'll also give you an example sentence. So you'll see how they're used professionally and how to talk about psychological conditions in a way that's accurate, respectful, and clinically appropriate. All right, let's get started and build your confidence in real clinical psychology English. Term number 1. Cognitive distortion. Cognitive distortion. This means an inaccurate or biased way of thinking that reinforces negative beliefs. Let's check out our example sentence. We've identified several cognitive distortions during the therapy session. Term number 2, rumination. Repeat after me. Rumination. Rumination is the repetitive passive focus on negative thoughts or feelings. The patient reports excessive rumination following stressful events. Term number 3, emotional regulation. Emotional regulation. This is the ability to manage and respond to emotional experiences appropriately. Our example sentence. Therapy focused on improving emotional regulation skills. Term number 4, trigger. Trigger. A trigger is a stimulus that causes an emotional or psychological reaction. Crowded spaces act as a trigger for the patient's anxiety. Term 5, maladaptive coping. Maladaptive coping. This is coping strategies that reduce stress short term but cause harm long term. Let's check out our example sentence. Avoidance was identified as a maladaptive coping behavior. Term number 6, insight. Repeat after me. Insight. Insight is the awareness and understanding of one's own mental state or behavior. The patient shows growing insight into their thought patterns. Term 7, baseline. Baseline. Baseline is a starting point used for comparison over time. We established a baseline to track symptom improvement. Term number 8, comorbidity. Repeat after me. Comorbidity. This is the presence of more than one mental health condition at the same time. Anxiety and depression were noted as comorbid conditions. If you're enjoying this lesson on psychological terms, make sure and pick up the guide that supports it. It's available right now in my YouTube store for $4.99. It's tagged with this video and linked in the video description. And if you're a student member of the channel, you'll get the guide as part of your membership. With student membership, you'll get a guide for each new lesson I publish. You'll also get early access on videos and priority requests for your lessons. Join today and join the growing Learning English Pro community. Let's move on to term number 9, therapeutic alliance. Therapeutic alliance. This is the collaborative relationship between therapist and client. Let's check out our example sentence. A strong therapeutic alliance was developed early in treatment. Term number 10, the halfway point. Boundary setting. Boundary setting. This is establishing clear emotional or behavioral limits. Sessions included work on boundary setting in relationships. Term number 11, cognitive load. Cognitive load. Cognitive load is the amount of mental effort being used at one time. High cognitive load may impact decision-making ability. Term number 12, behavioral activation. Repeat after me. Behavioral activation. This is encouraging engagement in meaningful activities to improve mood. Behavioral activation was introduced to address low motivation. If you're enjoying this lesson, make sure to hit the like button and subscribe to Learning English Pro for lots more professional English. We cover medical English and lots of business English. And if you have a suggestion for a video lesson, let me know in the comments below. I'd love to hear from you. Term number 13. Somatic symptoms. Somatic symptoms. These are physical symptoms that are linked to psychological distress. The patient experiences somatic symptoms during periods of stress. Term number 14. Affect. Affect. Affect is the observable expression of emotion. Let's check out our example sentence. The client presented with a flat affect during assessment. Term number 15. Dysregulation. Repeat after me. Dysregulation. Dysregulation is difficulty controlling emotional or behavioral responses. Emotional dysregulation was evident during the discussion. Term number 16. Psychoeducation. Psychoeducation. Psychoeducation is teaching clients about psychological concepts and conditions. Psychoeducation was provided on anxiety management. Term number 17. Resilience. Resilience. Resilience is the ability to recover from stress or adversity. Let's check out our example sentence. Therapy aimed to strengthen psychological resilience. Term number 18. Avoidance behavior. Repeat after me. Avoidance behavior. These are actions taken to evade distressing situations or thoughts. Avoidance behavior is maintaining the anxiety cycle. Term number 19. Reflective listening. Reflective listening. This is repeating or paraphrasing to show understanding. Reflective listening was used to validate the client's feelings. And our final psychological term, term number 20. Formulation. Formulation. Formulation is a structured explanation of a client's difficulties. Let's check out our final example sentence. The psychologist shared a formulation of the presenting issues. Well done. That brings us to the end of today's Clinical Psychology English lesson. If you work in healthcare as a carer or healthcare assistant, the words you use can make a huge difference. The way you speak to patients, families, and nurses can show calmness, respect, and professionalism. Or, if you're not careful, the opposite. In this lesson, I'll teach you how to sound more professional and confident when talking to patients or working alongside doctors and nurses. We'll look at everyday phrases people often use, and I'll show you how to transform them into clear professional English that fits naturally in real medical situations. Hi, my name's Jer, and this is Learning English Pro, the home of medical English on YouTube. On this channel, I'm helping you speak clear, confident English for real careers. There is a guide that comes with this lesson. If you'd like to pick it up, it's available in my YouTube store for $4.99. If you're a member of my student membership, it's available to you right now on the membership tab. You can join student membership for just $4.99 a month. You gain access to my complete PDF guide library and all my members-only videos. Okay, let's get started on our lesson. And our first everyday phrase is, he's losing a lot of blood. Now, this phrase can sound a bit emotional and dramatic. What can we say instead? He has significant blood loss. The phrase significant blood loss is calm, factual, and clinical, exactly how medical professionals report urgent conditions. Phrase number 2. She looks really sick. This sounds like it has a bit of personal judgment or maybe some emotional words attached. Instead, we should say, she appears unwell. This keeps your tone professional and objective. It's a polite, measured way to describe what you see. Phrase number 3. He's not waking up. This is quite a casual, informal way to report a patient's condition. Instead, you should say, he's unresponsive. The term unresponsive is the correct clinical description for a patient who doesn't react to voice, touch, or movement. Phrase number 4. She's having trouble breathing. Saying it like this can sound a bit alarmist. Instead, we should say, she's experiencing shortness of breath. This is one of the most common professional expressions used in handovers. Experiencing shortness of breath communicates the same meaning in a neutral medical tone. Phrase number 5. He's gone really pale. This phrase isn't suitable for documentation or for spoken updates. Instead, we could say, he appears pale. This is gentle clinical observation, and by saying it this way, you're removing emotion and focusing purely on what you notice. Phrase number 6. She's not making sense. This can sound almost insulting. A more professional way to report this is, she's disoriented. Disoriented means the person seems confused or unsure about where they are or what's happening. It's the standard word used by medical professionals in reports. Phrase number 7. He can't stop shaking. Like earlier phrases, this sounds very casual and almost alarmist. Instead, we should say, he's trembling continuously. By saying this, you're giving a clear professional image of what's happening. It describes the action accurately without using dramatic language. If you're enjoying this English medical lesson, make sure to subscribe, drop a like and comment. Let me know what area of English you're working in medicine and I'll make a video for you. I'd be only delighted to. Phrase number 8. She's passed out. Passed out is quite a casual and street way to talk about a patient's condition. Instead, we should say, she's collapsed, or we could say, she's unconscious. Both collapsed and unconscious are clear, respectful terms. They explain the situation precisely and are commonly used in emergencies, reports, and clinical settings. Phrase number 9. His heart's beating really fast. This doesn't sound professional at all. A much better way to say it in a professional context is, he has a rapid pulse. A rapid pulse is the medical way to describe a fast heartbeat. It's precise and easily understood by all medical staff, especially during patient observations. Phrase number 10. She's burning up. Burning up, again, is another casual way we can describe a patient's condition. A more professional way is to say, she has a high temperature. High temperature is the professional phrase for fever. It's objective and measurable, perfect for care notes or verbal updates. Phrase number 11. He's having a fit. By saying this, you might sound disrespectful. A more professional way we can describe the situation is, he's having a seizure. A seizure is the correct clinical term for what people often call a fit. It's more respectful and shows that you understand the medical nature of the condition. Phrase number 12. She's not eating anything. This really doesn't sound professional, and we have a much better way to say it in a medical context. She has a poor appetite. This phrase is commonly used in healthcare records. Poor appetite sounds professional, factual, and avoids emotional overtones. Phrase number 13. He's going to the toilet a lot. This is quite a simple and casual way to describe a patient's bathroom routines. Well, instead, we should say, he has increased urinary frequency. This is a common phrase used in both handovers and medical documentation. It's polite, specific, and fits perfectly into professional communication. Phrase number 14. She can't stop coughing. This phrase is very informal and not suitable for medical reports. Instead, you should say, she has a persistent cough. Persistent means it's continuing over time. This is the right way to describe a symptom that hasn't gone away, especially for reports or updates. Phrase number 15. He keeps getting dizzy. Keeps getting, again, sounds very casual and informal. Instead, we should say, he's experiencing dizziness. This phrasing sounds neutral and appropriate. It describes the symptom clearly without adding emotion or judgment. If you want to review all the information and content in today's lesson, pick up the guide for it. It's in the YouTube store and it's available right now for $4.99. If you're a student member of the channel, you can pick up your guide as part of your membership in the membership tab right now. You can join student membership today. You get access to all my PDF guides, and you'll get a new PDF for every new video that I publish. You'll also gain access to 300, yes, that's 300 of my members-only videos with lots and lots of interesting topics covering everything from work-related to household and lots more. Phrase number 16. She's bleeding from her nose. This is an incorrect way to report this in a medical context. Instead, you should say, she has a nosebleed. This simple change is more polite and a more professional way to describe this condition. It's the correct term you'll hear and used in care and medical settings. Phrase number 17. He threw up. Threw up is a very casual way to describe this situation. He vomited is a lot more appropriate and is really the proper medical term for this action. It's short, clear, and avoids slang, making it appropriate for reports or updates. Phrase number 18. She's feeling sick. This is not very accurate and could mean several different things. Instead, we should say, she's feeling nauseous. Using feeling nauseous communicates the same thing but sounds clinical and professional. It's a phrase doctors and nurses use every day. Phrase number 19. He wet himself. Using this phrase will lead to a lot of embarrassment if used in front of a patient. A more clinical way to say it is he's incontinent. Incontinent is the correct and respectful medical term. It describes the situation professionally and without embarrassment for the patient. Phrase number 20. Well done for getting this far. She can't control her bowels. This phrase is filled with judgment and not at all appropriate for a medical context. Instead, we should say, she's experiencing bowel incontinence. This phrase is discreet, compassionate, and accurate. It's widely used in healthcare settings to maintain dignity and clarity. Phrase 21. He's not drinking enough water. This sounds judgmental and quite casual. Instead, you should say, he has low fluid intake. This turns your observation into a professional statement. Low fluid intake is commonly used in care records to describe dehydration risk. Phrase 22. She's acting strange. This can sound inaccurate and disrespectful. Instead, we should say, she's showing unusual behavior. By saying this, you're removing emotional language and focusing purely on the observation. Phrase 23. He's fallen again. Here we have another phrase which sounds very judgmental. Another way we can say it is, he's had another fall. This is a much nicer way to report a repeated accident. It's professional, clear, and matches the language used in accident documentation. Phrase 24. We're almost finished. She's in a lot of pain. This phrase sounds very opinion-based. Instead, you should say, she reports severe pain. Using the word reports shows that you're accurately recording what the patient says, not your own opinion. It keeps your language factual and clinical. Now we're on to our final phrase. Well done for getting this far. Phrase 25. He's not getting better. Again, like many of our other phrases, this sounds very casual. Instead, you should say, his condition isn't improving. Condition isn't improving is the kind of phrase doctors and nurses use in professional discussions. It's calm, measured, and appropriate for updates. So there you have it, 25 professional phrases that will help you sound more confident, caring, and capable in any healthcare setting. Remember, being professional isn't about sounding complicated. It's about staying calm, respectful, and clear. Every word you use has power, especially when someone is scared or in pain. If you work in healthcare or are training as an occupational therapist, using the right language is just as important as the right techniques. You're very welcome to Learning English Pro, the home of medical English on YouTube. I'm your English teacher, Jer, and this is where I help healthcare professionals and students build confident professional English for real clinical settings. In today's lesson, we're focusing on essential occupational therapy vocabulary, the words and phrases OTs use every day when assessing patients, planning treatment, and working with multidisciplinary teams. We'll cover key terms used in assessments, functional mobility, self-care, cognition, discharge planning, and more, all explained clearly and simply with real medical examples. Don't forget to like and subscribe to Learning English Pro for lots more medical English lessons. Alright, let's get started. Term number 1. Activities of daily living, also known as ADLs. ADLs are basic self-care tasks required for everyday functioning. Let's use this term in an example sentence. The patient requires assistance with activities of daily living. Term number 2. Instrumental activities of daily living, otherwise known as IADLs. These are more complex tasks needed for independent living. We assessed her ability to manage instrumental activities of daily living. Term number 3. Functional mobility. Repeat after me. Functional mobility. This is the ability to move safely and effectively within an environment. Functional mobility has improved since the last session. Term number 4. Fine motor skills. Fine motor skills. Fine motor skills are small muscle movements used for precise tasks. Let's check out our example sentence. The therapy focuses on improving fine motor skills in the hands. Let's move on to term number 5, gross motor skills. Gross motor skills. These are large muscle movements involving the whole body. Gross motor skills were affected following the injury. Term number 6, sensory processing. Sensory processing. Sensory processing is how the nervous system receives, and responds to sensory input. The child shows difficulty with sensory processing. Term number 7. Cognitive function. Repeat after me. Cognitive function. This is mental processes such as memory, attention, and problem solving. Cognitive function was assessed during the initial evaluation. If you're enjoying this lesson, don't forget to pick up the guide that comes along with it. The Occupational English Guide is available right now in my YouTube store for just $4.99. And if you're one of my lovely student members, you can pick up your copy as part of your membership over on the membership tab right now. Student membership grants you access to all my PDFs. That's a new PDF with every new lesson and access to my complete library. There's tons of additional perks to check out. Click the link in the video description to join and get ready for a whole new world of professional English. Term number 8. Adaptive equipment. Adaptive equipment. These are tools designed to support independence in daily tasks. Adaptive equipment was recommended to support dressing. Term number 9. Range of motion. Range of motion. You'll sometimes see this abbreviated to the acronym ROM. And this means the extent to which a joint can move. We measured range of motion in the affected shoulder. Term number 10. Strengthening exercises. Strengthening exercises. These are activities designed to increase muscle strength. Strengthening exercises were added to the treatment plan. Term number 11. Functional assessment. Functional assessment. This is an evaluation of a person's ability to perform daily activities. Let's check out our example sentence. A functional assessment was completed during the first visit. Term number 12. Energy conservation. Repeat after me. Energy conservation. In occupational therapy, energy conservation are techniques used to reduce fatigue during daily activities. Energy conservation strategies were discussed with the patient. Term number 13. Joint protection. Joint protection. These are methods to reduce stress on joints during movement. Joint protection techniques were introduced for arthritis management. If you're enjoying this deep dive into occupational language, make sure to subscribe to Learning English Pro. This is the home of professional English on YouTube, so I cover medical and business English, and we dive into lots of different occupational types. If you have an idea for a lesson, let me know in the comments. I'd love to hear from you. Term number 14. Therapeutic activity. Therapeutic activity. This is a structured activity used to improve functional performance. The session included therapeutic activities for coordination. Term number 15. Upper limb function. Upper limb function. This is the ability to use the arms and hands effectively. Let's check out our example sentence. Upper limb function remains limited post-surgery. Term number 16. Splinting. Splinting. Splinting is the use of devices to support or immobilize a joint. Splinting was provided to support wrist alignment. Term number 17. Environmental modification. Environmental modification. This involves changes made to surroundings to improve safety and access. Environmental modifications were recommended for the home. Term number 18. Self-care skills. Self-care skills. These are abilities related to personal care tasks. Self-care skills have improved with ongoing therapy. Term number 19. Goal setting. Goal setting. Goal setting is establishing specific outcomes to guide therapy. Let's check out our example sentence. Goal setting was completed in collaboration with the patient. And now for our final term, term number 20, discharge planning. Repeat after me. Discharge planning. This is preparing a patient for safe transition from therapy services. Our final example sentence. Discharge planning began once functional goals were achieved. Well done, you just learned 20 essential occupational therapy terms for medical English. Hi, I'm Jer from Learning English Pro, and this is 100 English Phrases for Medicine, Medication, Prescriptions, and Patient Instructions. This lesson is packed with clear, professional phrases for healthcare workers, like nurses, doctors, and pharmacists, from giving dosage instructions to explaining side effects. Our first category of phrases is prescribing medication. I'm prescribing you this medication for your symptoms. Take 1 tablet twice a day. This is a long-term medication for chronic conditions. You will need to take this medication regularly. This medication should help reduce your symptoms. I'll write you a prescription for pain relief. Start with a low dose and increase as needed. This medication is only available by prescription. You'll need a refill every month. Take it exactly as directed. Great start. These phrases are essential when prescribing medication. Next, let's talk about how to explain dosage and timing to patients. If you're finding these phrases helpful, hit the like button and subscribe for more. Take 1 pill every 8 hours. Take it on an empty stomach. You should take it before meals. Take it with plenty of water. Don't exceed 4 doses in 24 hours. Take this medication only when needed. Space out the doses evenly. Take it at the same time each day. If you miss a dose, take it as soon as you remember. Do not double the dose if you miss one. Well done. Clear instructions about dosage and timing are crucial for patient safety. Now, let's move on to discussing side effects. If you'd like to see more lessons like this, join the student membership to support the channel and get access to the guide that comes with this lesson. You may experience mild drowsiness. This medication might cause nausea. Contact us if you experience any side effects. Stop taking it if you develop a rash. Some patients report headaches. You may feel dizzy after taking this. Dry mouth is a common side effect. Rarely, it can cause blurred vision. Report any unusual symptoms immediately. Most side effects are temporary. Knowing how to explain side effects clearly helps patients manage their expectations. Up next, we'll cover administering medication. And leave a comment if you found any of these phrases useful so far. I'm going to give you an injection. This will be administered intravenously. We'll start the infusion slowly. You'll feel a small pinch. I'll insert the IV into your arm. The medication will be delivered through a drip. I'm going to adjust the dosage. We'll monitor you during the infusion. Let me know if you feel any discomfort. You might feel a slight burning sensation. Great job! Administering medication safely is key. Next, let's talk about patient instructions. And remember to subscribe for more professional medical English lessons. Take your medication exactly as prescribed. Do not share your medication with anyone. Keep your medication out of the reach of children. Store it at room temperature. Do not crush or chew the tablets. Follow the dosage instructions carefully. Finish the full course, even if you feel better. Take your medication with a meal if it upsets your stomach. Avoid alcohol while taking this. Keep a medication diary to track doses. Giving clear instructions helps patients stay safe and compliant. Next, let's discuss medication safety. Don't forget to give this video a thumbs up if you're finding it helpful. Always read the label before taking any medicine. Check the expiration date before use. Store in a cool, dry place. Keep your medication in its original packaging. Don't use if the seal is broken. Dispose of expired medication safely. Never mix medication without consulting a doctor. Avoid self-medicating without guidance. Keep a list of all your current medications. Inform us if you're taking herbal supplements. Wow, safety first. Now let's cover medication adherence and why it's so important. If you're still watching, leave a comment saying "got it" to let me know you're following along. Have you been taking your medication regularly? It's important not to skip doses. Let me know if you're having trouble sticking to your schedule. Use a pill organizer to stay on track. Set a reminder for your next dose. Don't stop the medication without consulting us. Consistency is key for effective treatment. Follow the treatment plan strictly. Keep track of your doses to avoid missed ones. Let us know if you're experiencing difficulty. Well done, you're doing awesome. Let's move on to our 8th topic, drug interactions. Inform your doctor about all the medications you are taking. Avoid combining this with alcohol. Do not take this medication with grapefruit juice. Some antibiotics may reduce the effectiveness of birth control. check for potential interactions with your current medications. This medicine may interact with blood thinners. Let us know if you are taking any over-the-counter supplements. Be cautious when combining this with pain relievers. Consult your pharmacist about possible interactions. This medication can increase the effects of sedatives. Great, understanding drug interactions is crucial to patient safety. Now, let's move on to follow up on medication, which helps ensure ongoing care and effectiveness. If you want to explore these phrases even further, check out the guide for this lesson. It's full of additional language tips for every single phrase. The guide is available for student members over on the Student Membership tab, and it's also for sale in my YouTube store. How are you feeling after starting the new medication? Have you noticed any changes since beginning treatment? Are you experiencing any side effects? Have you been taking the medication as prescribed? Is the medication helping with your symptoms? Do you feel any improvements since the last visit? Are you having any trouble remembering to take your doses? Have you needed to use any additional pain relief? Would you like advice on managing your medication schedule? Let's review your medication plan together. Excellent. Following up on medication helps ensure that treatment is working as expected. Now for our final section, if you got this far, well done. We're going to cover education and advice for medication. Always complete the full course, even if you feel better. Store your medication in a secure place. Keep a list of your medications in your wallet. Inform your pharmacist if you are pregnant or breastfeeding. Do not share your medication with anyone else. Educate yourself about possible side effects. Read the patient information leaflet thoroughly. Take your medication as directed to avoid complications. Contact us if you're unsure about your dosage. Keep a journal of your symptoms while on this medication. And that's it, 100 essential phrases for medication. I hope you found these phrases practical and useful for your work in healthcare. And ever wonder how top physicians build instant trust and rapport with their patients? What if I told you there's a way to practice those precise communication skills in English with lots of empathy right from your home? Get ready to transform your patient interactions with my advanced shadowing scenarios. You're very welcome to Learning English Pro, the home of medical English on YouTube. My name is Jer and I'm your online English teacher. Let's dive right in. In today's lesson, you'll learn 20 advanced doctor-patient communication phrases. For each one, I'll give you the main phrase. This will be the exact sentence to shadow and repeat. And then I'll give you a little bit of context, why and when this sentence is useful. And you'll also get an additional bonus adaptation phrase, another way to say the same idea. That's 20 main phrases and 20 adaptation phrases, 40 phrases in total for you to master. Now here's my challenge to you. Can you shadow, repeat, and remember all 40 by the end of this week? Give yourself 7 days. Write challenge accepted in the comments if you're ready, and come back to the video as many times as you need to practice. And remember, this lesson has a full downloadable guide with even more context and tips. You'll find it inside the student membership, which you can join the buttons beneath the video, and also you can buy it separately in the YouTube store for just $4.99. So, on to our topic. When communication goes wrong in medicine, the cost is high. Patients may feel dismissed, conditions get misdiagnosed, and doctors get burnt out. Textbook medicine can treat the body, but without human connection, the patient suffers. That's why today's practice goes beyond vocabulary. You'll be training empathy, clarity, and patient-centered language. I'll say each phrase once and give you time afterwards to say it for yourself. Then I'll give you the context and also the adaptation phrase. Each time you'll shadow out loud with me. Repeat the sentence just as you hear it. Keep practicing. The more you repeat, the more natural this advanced medical English will feel. Let's get started with our phrases. I can hear how concerned you are. So with this phrase, we can validate a patient's worry or fear. Let's take a look at our adaptation phrase, a different way to say our main phrase. I understand that this feels worrying for you. Well done. Let's move on to our next phrase. Let's go step by step so it's clear. With this phrase, we are breaking down information into manageable parts for the patient. Let's take a look at a different way to say this phrase. We'll take this one part at a time. Okay, phrase number 3. From what you've described, I'd like to explore a few possibilities. With this phrase, you're showing clinical reasoning without making premature conclusions. Our adaptation phrase is, based on your symptoms, there are a few things we should consider. Phrase number 4. It sounds like this has been very frustrating for you. This sentence allows us to acknowledge the patient's emotional experience. Our adaptation phrase is, I can tell this has been difficult to deal with. We are already moving on to phrase number 5. Well done. Can you tell me more about when this started? This sentence is great because we are encouraging detail without rushing the patient. Another way to say it is, walk me through how this first began. Next, let's see what options are available together. This lovely sentence is all about shared decision-making instead of a doctor dictating treatment. We'll look at the different choices side by side. Phrase number 7. I'd like to check that I explained that clearly. This phrase is great during patient education and it uses the chunk and check technique after giving instructions. Let's take a look at another way we could say this. Can you tell me in your own words what the plan is? Well done, you're doing great. It's time for phrase number 8. I know you've already tried several treatments. Here with this phrase, we are recognizing a patient's past effort and we're doing this to build trust. Our adaptation phrase is, you've been through a lot of treatments already, haven't you? It's time for phrase number 9. This is not urgent, but it does need attention. This sentence is great for reassuring while you're also emphasizing importance of treatments or diagnostics. Here's another way we could say it. It's not an emergency, but we shouldn't ignore it. We're already at phrase 10, you guys. Well done for getting this far. Let's focus first on what's most troubling you today. Here we are prioritizing the patient's agenda in the consultation. Another way we could say it is, tell me the main issue you'd like us to address right now. Let's move on. I want to make sure you feel heard. This is a great sentence for building trust and patient satisfaction. Another way we could say it is, it's important to me that your concerns are fully understood. Phrase number 12. This might feel overwhelming, but we'll go through it together. This is a lovely sentence, and with it, you're offering reassurance during complex explanations. Our adaptation phrase is, there's a lot of information here, but I'll guide you step by step. I hope you're enjoying the lesson so far, and don't forget to take part in my 7-day challenge. Check back with a comment every day and let me know how it's going for you. Phrase number 13. I appreciate you sharing that detail with me. With this sentence, we are reinforcing openness when patients reveal sensitive and personal information. Our adaptation phrase is, thank you for being so open about that. Next up. Before we move on, is there anything I've missed? With this sentence, we are ensuring no concerns are left out. Our adaptation phrase is there something important that we haven't covered yet? Don't forget, if you're a student member, you can head over to the membership tab and download the guide for this lesson right now. It includes an additional glossary, extra language tips, articles, and exercises. Want to join student membership? It's only $4.99 a month and you get a PDF guide with every new lesson, plus access to my learning archive, 85 PDF guides, and over 300 English lessons. It's a great bargain. You can also pick up the guide for this lesson in my YouTube store. Everything is linked and tagged in the description. Let's move on to phrase number 15, and we're in the final stretch of our 40 phrases. I can see this is affecting your daily life. This is a brilliant sentence because with it we are recognizing the broader impact of illness on the patient's lives. Another way we could say it is, it seems this has had a big impact on your routine. Phrase number 16. Let's review your options and decide what feels best for you. Here with this sentence, we are encouraging patient involvement in their own care choices. Let's take a look at another way we could say this. We'll go over the choices and choose together what's most suitable. Let's move on. I'd like to double check I explained that correctly.
This sentence is a great way of confirming clarity and avoiding misunderstanding. Let's take a look at our adaptation phrase. Could you repeat back what the next step is, just to be sure I was clear? Our next phrase is, you're not alone in this. We'll manage it as a team. This phrase is great at providing emotional reassurance to patients and to families. Let's take a look at another way to say it. You don't have to face this by yourself. I'm here to support you. It's time for our penultimate phrase, phrase number 19. I want to respect your perspective as we make a plan. This lovely, kind sentence is filled with patient-centered care and it emphasizes collaboration. Our adaptation phrase is, your opinion matters. Let's factor that into our decision. And it's time for our final phrase. Do you feel ready to move forward with this plan? With our final phrase, we are checking patient agreement before closing the consultation. And finally, our last adaptation phrase. Are you comfortable with this next step? Well done for getting through all 20 main phrases and 20 adaptation phrases. That is 40 really useful English medical phrases for you to use in a healthcare setting right away. Don't forget to participate in my 7-day challenge. Learn every single main phrase and adaptation phrase. That's 40 phrases in 1 week. You can choose 3 main phrases and 3 adaptation phrases every day and you'll get through them. Well done for participating and let me know in the comments how you got on. And remember, the best physicians and doctors don't just treat conditions, they communicate with empathy, clarity and respect. By mastering these phrases, you're not just improving your English, you're building the skills to connect deeply with patients. If this lesson was helpful, hit like, subscribe and share it with a colleague. And don't forget to comment with your biggest communication challenge. I read every one and I'll reply to you too. Hello and welcome back to Learning English Pro. In this lesson, we're going to cover medical conversation listening. You'll hear 5 short conversations between a nurse and a doctor. Each conversation will play twice. The second time, you will see 2 questions on screen related to the conversation you're hearing. Use these questions to test your listening skills and challenge your comprehension. There are 10 questions in total, so write your score in the comments. The full transcripts for all conversations are available through the student membership for Learning English Pro. It's just $4.99 per month. Members get access to PDF guide downloads, my video library, early access, priority requests, and additional content. This is Learning English Pro, English skills for ambitious careers. If you find this lesson helpful, like, subscribe, and hit the notification bell so you never miss a new lesson. Leave a comment with your score and let me know how you did. Let's get started.
Dr. James, sorry to disturb you. I've just been in to check on Mr. LeBlanc in room 14. He's really agitated and disoriented. I'm a bit concerned.
No problem, Priya. What's happening with him exactly?
Well, he didn't recognize me. Thought he was still in the operating theater. He kept saying he was late for his surgery and trying to get out of bed, even though he's got a catheter in. His vitals are stable, but his heart rate is slightly elevated.
That sounds like post-operative delirium. Has he had any pain relief recently?
Yes, he had 5 milligrams of morphine at around 3 a.m. He's due for another dose in about an hour, but I'm not sure if it's helping or making things worse. Last night he was relatively calm.
It could be a reaction to the morphine. Sometimes it can cause confusion, especially in older patients. Has he had a similar reaction before?
Actually, yes. His chart notes some mild confusion after his gallbladder surgery last year, but nothing this severe.
Okay, let's reassess his medication plan. I think we should hold off on the next morphine dose and switch to paracetamol IV for now. We'll see if reducing the opioids helps stabilize his mental state.
That sounds good. I'll make the note and inform the night staff. Do you think we should run any other tests?
Let's do a quick set of bloods to rule out any infection. Sometimes post-op confusion can be linked to something underlying, like a UTI or electrolyte imbalance.
I can collect the urine sample now and send it to the lab along with the bloods. Should we also check his hydration status?
Definitely. Dehydration could be a factor. Can you monitor his fluid balance over the next few hours?
Of course. I'll record his input and output, and we'll monitor his vitals closely.
Great. Let's also make sure he's in a calm environment. Lights dimmed, minimal noise. Sometimes overstimulation can worsen delirium.
I'll make sure the curtains are drawn and reduce the noise level. Should I also inform his family about his confusion?
Yes, it's a good idea. Explain that this can happen after surgery and that we're actively managing it. Reassure them that it's usually temporary.
Understood. I'll give them a call and update them. Thanks for discussing this with me. I really appreciate the support.
No problem at all. You're doing great work. Let's catch up in an hour and see how he's doing.
Will do. Thanks, doctor. Dr. James, sorry to disturb you. I've just been in to check on Mr. LeBlanc in room 14. He's really agitated and disoriented. I'm a bit concerned.
No problem, Priya. What's happening with him exactly?
Well, he didn't recognize me. Thought he was still in the operating theater. He kept saying he was late for his surgery and trying to get out of bed, even though he's got a catheter in. His vitals are stable, but his heart rate is slightly elevated.
That sounds like post-operative delirium. Has he had any pain relief recently?
Yes, he had 5 milligrams of morphine at around 3 a.m. He's due for another dose in about an hour, but I'm not sure if it's helping or making things worse. Last night he was relatively calm.
It could be a reaction to the morphine. Sometimes it can cause confusion, especially in older patients. Has he had a similar reaction before?
Actually, yes. His chart notes some mild confusion after his gallbladder surgery last year, but nothing this severe.
Okay, let's reassess his medication plan. I think we should hold off on the next morphine dose and switch to paracetamol IV for now. We'll see if reducing the opioids helps stabilize his mental state.
That sounds good. I'll make the note and inform the night staff. Do you think we should run any other tests?
Let's do a quick set of bloods to rule out any infection. Sometimes post-op confusion can be linked to something underlying, like a UTI or electrolyte imbalance.
I can collect the urine sample now and send it to the lab along with the bloods. Should we also check his hydration status?
Definitely. Dehydration could be a factor. Can you monitor his fluid balance over the next few hours?
Of course. I'll record his input and output, and we'll monitor his vitals closely.
Great. Let's also make sure he's in a calm environment. Lights dimmed, minimal noise. Sometimes overstimulation can worsen delirium.
I'll make sure the curtains are drawn and reduce the noise level. Should I also inform his family about his confusion?
Yes, it's a good idea. Explain that this can happen after surgery and that we're actively managing it. Reassure them that it's usually temporary.
Understood. I'll give them a call and update them. Thanks for discussing this with me. I really appreciate the support.
No problem at all. You're doing great work. Let's catch up in an hour and see how he's doing.
Will do. Thanks, doctor.
Dr. Khan, I'm really sorry to bother you, but the portable ECG is acting up again. That's the third time today. I restarted it twice, but it just shows a blank screen.
You've got to be kidding. We had that machine service just last month. Which patient are we talking about?
It's Mr. Simmons in bed 5. He's reporting chest tightness and shortness of breath. I tried switching to the backup machine, but it's not charged.
All right, let's not waste any more time. We need to get him on a monitor immediately. Can we transfer him to the main ward for continuous monitoring?
I've called the porters, but they said it would take about 15 minutes. I thought about using the stationary monitor in Bay 3 instead.
Good thinking. Let's move him ourselves. We can't afford to wait that long. I'll help you transfer him.
Thanks. I've already prepared oxygen and aspirin, just in case. His vitals are stable for now, but he seems anxious.
Good call. Anxiety could be a factor here. Make sure to reassure him as we move. Once we get him settled, I'll do a quick physical exam.
Got it. I'll explain to him that we're just being cautious and that moving to Bay 3 is standard procedure.
Perfect. Let's also notify the cardiac team. If his symptoms worsen, we might need their input.
I'll do that right away. Do you think it's worth filing another maintenance request for the ECG machine?
Definitely. This is a recurring issue and it's impacting patient care. Let's document the problem and escalate it to the equipment manager.
I feel like this happens way too often. Sometimes I worry we're just patching up problems instead of solving them.
I hear you. It's frustrating, but for now, let's focus on Mr. Simmons. You've handled this well, keeping calm and proactive.
Thanks. I just hate feeling unprepared when equipment fails.
That's completely understandable. You did the right thing by acting quickly and thinking on your feet. Let's follow up with maintenance after this.
Okay, I'll start the transfer now. Thanks for being so supportive.
We're a team. Let's make sure Mr. Simmons is comfortable and reassured.
Dr. Khan, I'm really sorry to bother you, but the portable ECG is acting up again. That's the third time today. I restarted it twice, but it just shows a blank screen.
You've got to be kidding. We had that machine service just last month. Which patient are we talking about?
It's Mr. Simmons in bed 5. He's reporting chest tightness and shortness of breath. I tried switching to the backup machine, but it's not charged.
All right, let's not waste any more time. We need to get him on a monitor immediately. Can we transfer him to the main ward for continuous monitoring?
I've called the porters, but they said it would take about 15 minutes. I thought about using the stationary monitor in Bay 3 instead.
Good thinking. Let's move him ourselves. We can't afford to wait that long. I'll help you transfer him.
Thanks. I've already prepared oxygen and aspirin, just in case. His vitals are stable for now, but he seems anxious.
Good call. Anxiety could be a factor here. Make sure to reassure him as we move. Once we get him settled, I'll do a quick physical exam.
Got it. I'll explain to him that we're just being cautious and that moving to Bay 3 is standard procedure.
Perfect. Let's also notify the cardiac team. If his symptoms worsen, we might need their input.
I'll do that right away. Do you think it's worth filing another maintenance request for the ECG machine?
Definitely. This is a recurring issue and it's impacting patient care. Let's document the problem and escalate it to the equipment manager.
I feel like this happens way too often. Sometimes I worry we're just patching up problems instead of solving them.
I hear you. It's frustrating, but for now, let's focus on Mr. Simmons. You've handled this well, keeping calm and proactive.
Thanks. I just hate feeling unprepared when equipment fails.
That's completely understandable. You did the right thing by acting quickly and thinking on your feet. Let's follow up with maintenance after this.
Okay, I'll start the transfer now. Thanks for being so supportive.
We're a team. Let's make sure Mr. Simmons is comfortable and reassured.
Dr. Lee, could I have a quick word? It's about the central line placement for Mr. Turner in bed 7.
Of course, Fatima. What's on your mind?
I didn't want to say anything in front of the intern earlier, but I noticed that he broke the sterile field. His glove brushed the monitor cable while adjusting the line, and he didn't change gloves. I wasn't sure how to address it at the time.
Thanks for telling me. That's definitely a concern. Was the patient exposed to any open wounds during the procedure?
Not directly. The insertion site was still covered, but I'm worried about contamination. I was debating whether to speak up during the procedure, but I didn't want to undermine him.
It's a tricky situation, and I appreciate your discretion. In those cases, it's always better to prioritize patient safety, even if it feels uncomfortable. I would have backed you up if you had mentioned it.
Next time, I'll say something immediately. I just didn't want to disrupt his focus.
That's understandable. If it helps, we can arrange a quick debrief with him so he knows for next time. I'll make sure it's supportive, not critical.
That would be really helpful. I also wondered if we should do anything preventative for Mr. Turner since there's a potential contamination risk.
Good thinking. Let's start with close monitoring of the site for any signs of infection, redness, swelling, or discharge. We can also mark it in the notes so that everyone is aware.
Should we consider starting prophylactic antibiotics just to be safe?
Since the risk is relatively low, I'd prefer to hold off and monitor first. If anything develops, we can reassess. What's your gut feeling on his overall condition?
He's stable, but a bit anxious after the procedure. I reassured him that everything went smoothly, but I'll keep an eye on his vitals.
Sounds good. I'll follow up with the intern. We'll approach it as a learning point, and I'll make sure he knows you acted in the patient's best interest.
Thank you for handling it so professionally. I really value that.
And I value your judgment. You did the right thing by raising this. Let's make sure Mr. Turner remains stable.
Dr. Lee, could I have a quick word? It's about the central line placement for Mr. Turner in bed 7.
Of course, Fatima. What's on your mind?
I didn't want to say anything in front of the intern earlier, but I noticed that he broke the sterile field. His glove brushed the monitor cable while adjusting the line, and he didn't change gloves. I wasn't sure how to address it at the time.
Thanks for telling me. That's definitely a concern. Was the patient exposed to any open wounds during the procedure?
Not directly. The insertion site was still covered, but I'm worried about contamination. I was debating whether to speak up during the procedure, but I didn't want to undermine him.
It's a tricky situation, and I appreciate your discretion. In those cases, it's always better to prioritize patient safety, even if it feels uncomfortable. I would have backed you up if you had mentioned it.
Next time, I'll say something immediately. I just didn't want to disrupt his focus.
That's understandable. If it helps, we can arrange a quick debrief with him so he knows for next time. I'll make sure it's supportive, not critical.
That would be really helpful. I also wondered if we should do anything preventative for Mr. Turner since there's a potential contamination risk.
Good thinking. Let's start with close monitoring of the site for any signs of infection, redness, swelling, or discharge. We can also mark it in the notes so that everyone is aware.
Should we consider starting prophylactic antibiotics just to be safe?
Since the risk is relatively low, I'd prefer to hold off and monitor first. If anything develops, we can reassess. What's your gut feeling on his overall condition?
He's stable, but a bit anxious after the procedure. I reassured him that everything went smoothly, but I'll keep an eye on his vitals.
Sounds good. I'll follow up with the intern. We'll approach it as a learning point, and I'll make sure he knows you acted in the patient's best interest.
Thank you for handling it so professionally. I really value that.
And I value your judgment. You did the right thing by raising this. Let's make sure Mr. Turner remains stable.
Dr. Kamal, can I talk to you for a moment? It's about Mrs. O'Neill's daughter.
Of course. What's going on?
She's really struggling. Even though we discussed the palliative care plan yesterday, she keeps insisting that we do more. She's asking for more tests and a second opinion.
That's understandable. Sometimes acceptance takes time. Did she say what specifically she's worried about?
She kept repeating, "You're giving up on her." I tried to explain that we're focused on comfort now, but it didn't seem to reassure her.
That's tough. Sometimes families feel helpless when there's no active treatment. Did you ask her what she thinks doing more would look like?
Yes, she mentioned trying a different medication. She even asked if we could transfer her mother to another hospital. I didn't want to outright say it wasn't possible.
You did the right thing by listening. I can call her and go over the plan again. Sometimes hearing it from both of us can help.
That might work. I just worry about how much we can really say without making promises.
It's a fine line. We can acknowledge her feelings without giving false hope. I'll explain that the team is constantly reassessing to ensure her mother's comfort.
Should we involve palliative care again to help address her concerns?
Yes, let's get them on board. They're skilled at guiding families through this. Also, let's document the family's concerns so it's clear that we're being thorough.
Good idea. I'll make a note in the file after we speak to her. Do you think we should set up a follow-up meeting with the family?
Absolutely. Maybe a family conference where we can discuss the plan in a supportive environment. That way, they know we're still actively involved in her care.
I can arrange that. I'll also spend some time with Mrs. O'Neill to make sure she's comfortable and talk to her a bit.
Great. Let's keep reassuring both the patient and the family. You're handling this really well.
Thanks, Doctor. I just want to make sure I'm doing right by the family while keeping realistic expectations.
You are. Balancing empathy and honesty is never easy, but you're doing it with compassion.
Dr. Kamal, can I talk to you for a moment? It's about Mrs. O'Neill's daughter.
Of course. What's going on?
She's really struggling. Even though we discussed the palliative care plan yesterday, she keeps insisting that we do more. She's asking for more tests and a second opinion.
That's understandable. Sometimes acceptance takes time. Did she say what specifically she's worried about?
She kept repeating, "You're giving up on her." I tried to explain that we're focused on comfort now, but it didn't seem to reassure her.
That's tough. Sometimes families feel helpless when there's no active treatment. Did you ask her what she thinks doing more would look like?
Yes, she mentioned trying a different medication. She even asked if we could transfer her mother to another hospital. I didn't want to outright say it wasn't possible.
You did the right thing by listening. I can call her and go over the plan again. Sometimes hearing it from both of us can help.
That might work. I just worry about how much we can really say without making promises.
It's a fine line. We can acknowledge her feelings without giving false hope. I'll explain that the team is constantly reassessing to ensure her mother's comfort.
Should we involve palliative care again to help address her concerns?
Yes, let's get them on board. They're skilled at guiding families through this. Also, let's document the family's concerns so it's clear that we're being thorough.
Good idea. I'll make a note in the file after we speak to her. Do you think we should set up a follow-up meeting with the family?
Absolutely. Maybe a family conference where we can discuss the plan in a supportive environment. That way, they know we're still actively involved in her care.
I can arrange that. I'll also spend some time with Mrs. O'Neill to make sure she's comfortable and talk to her a bit.
Great. Let's keep reassuring both the patient and the family. You're handling this really well.
Thanks, Doctor. I just want to make sure I'm doing right by the family while keeping realistic expectations.
You are. Balancing empathy and honesty is never easy, but you're doing it with compassion.
Dr. Alvarez, can I just grab you for a second? It's about Mr. Chow's discharge meds.
Of course, Jasmine. What's the issue?
His chart says he's on 20 milligrams of lisinopril, but the discharge form only lists 10 milligrams. I didn't want to send him home with the wrong dose, so I held off processing it.
Good catch. Let me double-check his medical record. Sometimes the electronic system pulls outdated information.
That's what I thought too. The form looks like it's from his last admission, not the current one.
You're right. The system pulled up his previous discharge plan. It should be 20 milligrams as per his latest treatment adjustment. Thanks for spotting that.
No problem. Do you want me to call pharmacy and have it corrected?
Yes, please. Make sure they update it on his electronic file, too. We don't want this to repeat next time he's admitted.
Will do. Do you think it's worth noting in his chart that the error was caught before discharge?
Absolutely. Documenting that is essential. It shows due diligence and highlights that the error was identified before any risk to the patient.
I'm glad I caught it. I nearly missed it because the previous dose was on top.
It happens. The important thing is you trusted your instincts and double-checked. I really appreciate that.
Thanks. I just don't like the idea of a patient going home with the wrong dose, especially with lisinopril. It could have caused some serious issues.
Exactly. Blood pressure management is crucial. I'll make a note for the pharmacy manager to review the electronic template. It shouldn't be pulling outdated data like that.
That would help. It's not the first time I've seen this happen. Maybe they could add a prompt to double-check previous admissions.
Great idea. Let's suggest that in the next team meeting. Meanwhile, let's get Mr. Chow sorted so he can go home safely.
I'll update the file and give pharmacy a quick call. I'll also explain to Mr. Chow that we've double-checked his meds.
Good plan. Make sure he knows it's all sorted before he leaves. You've done great work on this.
Thanks. I just want to make sure everything's right. I'll follow up on the pharmacy update, too.
Perfect. Let me know if you need any more support.
Dr. Alvarez, can I just grab you for a second? It's about Mr. Chow's discharge meds.
Of course, Jasmine. What's the issue?
His chart says he's on 20 milligrams of lisinopril, but the discharge form only lists 10 milligrams. I didn't want to send him home with the wrong dose, so I held off processing it.
Good catch. Let me double-check his medical record. Sometimes the electronic system pulls outdated information.
That's what I thought, too. The form looks like it's from his last admission, not the current one.
You're right. The system pulled up his previous discharge plan. It should be 20 milligrams as per his latest treatment adjustment. Thanks for spotting that.
No problem. Do you want me to call pharmacy and have it corrected?
Yes, please. Make sure they update it on his electronic file, too. We don't want this to repeat next time he's admitted.
Will do. Do you think it's worth noting in his chart that the error was caught before discharge?
Absolutely. Documenting that is essential. It shows due diligence and highlights that the error was identified before any risk to the patient.
I'm glad I caught it. I nearly missed it because the previous dose was on top.
It happens. The important thing is you trusted your instincts and double-checked. I really appreciate that.
Thanks. I just don't like the idea of a patient going home with the wrong dose, especially with lisinopril. It could have caused some serious issues.
Exactly. Blood pressure management is crucial. I'll make a note for the pharmacy manager to review the electronic template. It shouldn't be pulling outdated data like that.
That would help. It's not the first time I've seen this happen. Maybe they could add a prompt to double-check previous admissions.
Great idea. Let's suggest that in the next team meeting. Meanwhile, let's get Mr. Chow sorted so he can go home safely.
I'll update the file and give pharmacy a quick call. I'll also explain to Mr. Chow that we've double-checked his meds.
Good plan. Make sure he knows it's all sorted before he leaves. You've done great work on this.
Thanks. I just want to make sure everything's right. I'll follow up on the pharmacy update, too.
Perfect. Let me know if you need any more support.
Great job completing this medical conversation listening English lesson. Remember, practicing listening skills like this can make a huge difference in your professional communication. Don't forget to share your score in the comments below. I'd love to hear from you and how you got on. If you're trying to help, but one wrong sentence and the patient shuts down, loses trust, or even files a complaint. These 10 phrases, you should never say them. I'm Jer, and this is Learning English Pro, the home of medical English on YouTube. Every week I bring you clear, powerful English to use at work, especially in high-pressure moments. Today we're flipping the script. Instead of learning what to say, you'll learn what not to say. These are the phrases that sound polite or helpful, but can confuse, upset, or even damage a patient relationship. And yes, there's a full worksheet available for this lesson. It includes all the phrases from today, a helpful glossary, and a matching activity to test your memory. If you're a student member, you already have access. Every new lesson comes with a downloadable workbook or guide, and as a student member, you also unlock my full library. That's over 80 PDFs and 300 video lessons on everything from desserts to deserts and lava to love. If you're not a member yet, you can sign up. There's a button below the video to join. The worksheet for this video is also available on my YouTube store for just $1.99. And if you want to study live with me, join my vertical live streams right here on YouTube. We can chat in English, explore past lessons, and go behind the scenes of this channel together. So hit the like, leave a comment, and subscribe for more real-world medical English every single week. Let's dive in. Our first situation is when a patient comes in with vague symptoms. Nothing serious stands out, but they're clearly concerned. Here's what not to say. It's probably nothing. This might sound reassuring, but it can make the patient feel dismissed or foolish for coming in. They may leave feeling unheard or embarrassed. What could you say instead? Let's run some tests to be sure. This phrase still offers calm reassurance, but shows you're taking them seriously. It builds trust and keeps the door open for further care if needed. Let's move on to our next situation. You're dealing with a patient who's visibly upset, maybe crying or raising their voice. The tension is high. Here's what not to say. Calm down. Telling someone to calm down usually makes them feel judged or invalidated. It can escalate tension instead of resolving it. Here's what to say instead. I can see you're upset. Let's talk through it together. This acknowledges their emotions without sounding controlling. It helps the patient feel seen, not silenced. Next up, you suspect the issue with a patient might be psychological, like stress, anxiety, maybe even panic, but they're describing real physical symptoms. Here's what not to say. It's just your anxiety. This sounds dismissive and can make patients feel like you're not taking their symptoms seriously, even if they are anxiety related. Here's what to say instead. These symptoms can be linked to stress, but we'll check everything carefully. This phrase gently introduces the idea of anxiety while showing commitment to thorough care. It protects the patient's dignity. Next up, you have a patient who finally comes in after they delayed their own treatment. Their condition has clearly gotten worse. Here's what you shouldn't say. You should have come in earlier. This can feel like blame. It makes patients feel guilty or ashamed, which may stop them coming back. Here's what you can say instead. I'm glad you came in today. Let's focus on what we can do now. By saying this phrase, you're reassuring them that they did the right thing and keeps the focus on treatment and progress. I hope you're enjoying this lesson from Learning English Pro with me, Jer. Don't forget to join my vertical lives, set the alerts and subscribe to my channel to get updated when I'm going live. I'd love for you to join me and have a chat together. Let's move on to our fifth scenario. Oh no, you've made a small mistake, a small misstep during a procedure, or maybe dropping something, and the patient notices. What do you not say? Don't say, oops. Even if it's minor, saying oops can trigger panic in patients. It sounds careless or unprofessional in a clinical setting. Here's what we can say instead. Let me fix that right away. It acknowledges the issue calmly and confidently, helping the patient feel safe and in capable hands. Next up, you have a patient who asks you to do something outside your role, maybe booking an appointment, delivering medication, or answering a clinical question you're not qualified for. What do you not say? You don't say, that's not my job. Because this sounds cold or defensive, especially to a patient who's already confused or overwhelmed. So what can you say? Let me check who can help you with that. It shows you're still part of the team and keeps the patient feeling supported, even if you're handing them off to someone else. Our next scenario is when you don't know the answer. The patient's asking you something outside your expertise or knowledge and you feel unprepared. Don't say, I don't know. Honesty is important, but this phrase can make the patient feel abandoned or unsafe. So what should you say? I'm not sure, but I'll find out for you. It's honest but proactive. It shows you're still committed to helping, even if you don't have the answer right now. Let's move on. A patient is nervous about a procedure, a test, or a diagnosis. They're asking for reassurance. Don't say, you'll be fine. This phrase is vague reassurance that often sounds empty. If things don't go well, it can damage their trust. So what can you say? We'll do everything we can, and I'll keep you informed each step of the way. This phrase sets realistic expectations while still offering comfort and keeps communication open and respectful. If you want to dive deeper into these phrases, don't forget by becoming a student member with Learning English Pro, you get access to this PDF and every PDF I've ever published, along with my archive of 300 plus videos on lots of really interesting English topics. Sign up today. The button is just below the video and there's a link in the video description. We are down to our final two phrases. Let's keep going. Our next scenario involves a family member or a patient who is pushing back against a rule, maybe visiting hours, food restrictions, or discharge protocol, and you have to hold the line. Here's what not to say. It's policy. This can feel robotic or dismissive, like you're hiding behind a rule instead of engaging with the patient's concern. So what can you say? Let me explain why we do it this way. It's for your safety. This phrase offers clarity, not just rules. Patients are much more likely to accept a boundary if they understand the reason behind it. And now, our final scenario. This one is a difficult scenario. The treatment options are limited for a patient, and the situation isn't improving. The patient's emotions are heavy. Don't say, there's nothing more we can do. If you say this, it can sound final and hopeless. For many patients, it feels like you're giving up on them. So what can you say in this scenario? Let's talk about how we can keep you comfortable and supported moving forward. By saying this, you're shifting the focus to comfort, dignity, and emotional care, even when medical treatment may have reached its limit. Well done for sticking through all 10 phrases and scenarios. Medical English isn't just about the right words, it's about knowing what not to say and why it matters. One wrong phrase can damage trust, cause confusion, or even lead to a complaint. But the right language, it makes you sound calm, capable, and compassionate. If you found this helpful, hit the like button and leave a comment with the phrase that surprised you the most. And subscribe for more lessons every week, including lots of business English as well. Have you ever wondered that your English sounds too casual at work? Maybe you work in a hospital, a clinic, or you're a medical interpreter. And sometimes you're just not sure if your English sounds professional enough. Well, in today's lesson, I'm going to show you how to transform everyday sentences into professional medical English, the kind of language doctors, nurses, and interpreters use every day. I'll give you 20 examples, and I'll explain exactly why each professional version sounds better, so you can sound confident, accurate, and natural when speaking with patients or colleagues. You're very welcome to Learning English Pro, the home of medical English on YouTube. My name is Ger, I'm your English teacher for today, and I'm very happy to guide you through becoming confident, fluent, and ready for a real-life English communication. You can also download today's full guide from my YouTube store. It's available right now. Or you can get it as part of your student membership when you join my channel and get all my medical English lessons and worksheets. Okay, let's get started on our 20 phrases. Our first basic phrase is the patient is not waking up. The phrase not waking up sounds emotional and uncertain. We should change this phrase to the patient is unresponsive. Unresponsive is the correct clinical term. It's objective and instantly understood by medical professionals. Phrase number 2. He's feeling really dizzy. Saying feeling dizzy is informal and subjective. We should say he's experiencing dizziness. In medical English, experiencing dizziness turns it into a reportable symptom. Phrase number 3. She can't breathe properly. Can't breathe properly may sound dramatic or panicked. We should change this sentence to she's having difficulty breathing. Difficulty breathing is the accepted phrase in hospitals and reports. Phrase number 4. His heart stopped. This is very plain language. Instead, we should say he went into cardiac arrest. Here, cardiac arrest is the technical term. Using the medical phrase ensures precision, especially when communicating with medical staff. We're already on phrase number 5. She's getting worse. How is this wrong? The phrase getting worse is vague and emotional. Instead, we should say, her condition is deteriorating. Deteriorating communicates the same idea, but with professional distance and clarity. If you're enjoying this lesson, make sure to pick up the guide that comes with it. It's available in the YouTube store and it's also there in the membership tab for my lovely student members. You can join student membership today. All links are in the video description. Phrase number 6. He's fine now. Saying fine is too general. It could mean anything from comfortable to fully recovered. We should say, he's stable at the moment. Stable has a specific clinical meaning. The patient's vital signs are not changing dangerously. Phrase number 7. We'll check again later. Check again later sounds casual and uncertain. We should change this to we'll monitor the patient's progress. Monitor progress shows continuous care and structured observation. Phrase number 8. The wound is getting better. Getting better is informal and unclear. Instead, we should say, the wound is healing well. Healing well is concise, positive, and medically appropriate. Phrase number 9. She has a high fever. Now, what could we say instead of this? I would say, she's running a temperature of 39 degrees. When possible, replace emotional language like high fever with measurable data. Phrase number 10. We're at the halfway point. Well done for getting this far. He threw up after the medicine. Threw up is slang. Vomited is the medical term. So we should say, he vomited after taking the medication. Likewise, medicine becomes medication in formal healthcare English. Phrase number 11. We're waiting for the test results. The word waiting can feel passive. We should change this to, we're awaiting the lab results. Awaiting adds formality and control. It's the kind of word you'd see in documentation or during handovers. Phrase number 12. He's bleeding a lot. Bleeding a lot sounds emotional and imprecise. We should change this phrase to, he's experiencing heavy bleeding. Heavy bleeding is a standard phrase in medicine, and experiencing frames it as observation rather than a panic. If this is your first time with Learning English Pro, I'm so happy you're here. Make sure and drop a like on this video and subscribe for even more medical English. And if you want to learn some casual English, join me on my daily lives at 4 p.m. GMT. I'd love to chat with you. Phrase number 13. I'm going to give you some medicine. Give you some medicine here sounds informal and vague. Instead, we should say, I'm going to administer your medication. Administer your medication shows authority and professionalism. It's the language of trained staff. Phrase number 14. You need to stop eating before the test. In everyday English, stop eating is clear but basic. Instead, we should say, you need to fast before the procedure. Fast is the technical term used in hospitals. Using it signals that you understand the process and medical expectations. We're in the final stretch. Phrase number 15. She's not eating much. Not eating much is descriptive, but very casual. Instead, we should say, she has a poor appetite. Poor appetite is the recognized medical phrase for reduced food intake. Phrase number 16. We'll fix your broken arm. The word fix is friendly, but too informal for a hospital context. Instead, we should say, we'll treat the fracture. Treat the fracture sounds competent and professional. Fracture is also the precise term for a broken bone. Term number 17. He's losing a lot of blood. Losing a lot feels emotional and subjective. Instead, we should say, he has significant blood loss. Significant blood loss quantifies the situation and fits the neutral measured tone of medical communication. Phrase number 18. She has trouble sleeping. The term trouble sleeping is rather conversational. Instead, we should say, she's experiencing insomnia. And of course, insomnia is the official diagnosis term. Using it shows accuracy and awareness of medical vocabulary. We're down to the final two. Term number 19. His blood sugar is high. High blood sugar is acceptable, but just for daily conversation. Instead, we could say, he has elevated blood glucose levels. By saying elevated blood glucose levels, you sound analytical and professional. And our final phrase. You might need surgery. Need surgery can sound abrupt and even frightening to a patient. Instead, you should say, a surgical intervention may be required. Our final professional phrase sounds careful, professional, and respectful. It softens the message while keeping it accurate. Well done, you've just really upgraded your medical English and you'll sound a lot more confident in hospital and medical situations. Remember, being professional in English isn't about sounding complicated, it's about sounding clear, calm, and confident. Every phrase you've learned today helps you communicate more like a native medical professional, accurate, respectful, and easy to understand.
If you found this lesson helpful, don't forget to like, subscribe, and tell me in the comments which phrase you're going to start using first. You can also download the full guide for this video from my YouTube store, or you can get it as part of my student membership, which includes every medical and business worksheet and guide I've made so far, and you'll gain access to over 300 English lessons. When you're interpreting in a hospital, your words are more than just translations. They are bridges between people, cultures, and care. Hi, I'm Jer from Learning English Pro, the home of Medical English on YouTube, and today's video is a complete training tool for medical interpreters working in real-world settings. We'll go through 100 useful professional English phrases, all grounded in actual conversations from clinics, hospitals, and community health settings. This lesson is designed to help you sound more confident, stay calm in high-pressure situations, and provide the most accurate, human-centered interpretation possible. We'll break the lesson into 10 themed sections with 10 phrases in each. And I'll be giving you lots of quiz questions throughout to check your comprehension. So whether you're training, revising, or already on the job, you'll walk away with practical tools to use right away. For my student members, there is a fantastic downloadable PDF version of this lesson, complete with exercises, listening practice, and glossary support. Each phrase is in the guide and comes with an additional full explanation of both its meaning and nuances. You can access the guide through my student membership. The link to join is in the video description, or you can purchase it as a one-time download from my YouTube store for just $4.99. Stick around after the 100 phrases for some more additional medical lessons I'm including in this video. Everything is timestamped in the video description for easy navigation. Okay, let's jump into our first topic, general intake and checkups. You'll hear each phrase twice for perfect pronunciation. The interpreter will now interpret everything said in the first person. The interpreter will now interpret everything said in the first person. Please speak directly to the patient, not to me. Please speak directly to the patient, not to me. Can you tell me the reason for your visit today? Can you tell me the reason for your visit today? Do you have any allergies to medication? Do you have any allergies to medication? How would you rate your pain on a scale from 1 to 10? How would you rate your pain on a scale from 1 to 10? Have you experienced this issue before? Have you experienced this issue before? When did symptoms start? When did symptoms start? Are you currently taking any medication? Are you currently taking any medication? Let me know if you'd like me to repeat or clarify anything. Let me know if you'd like me to repeat or clarify anything. I will interpret everything you say as accurately as possible. I will interpret everything you say as accurately as possible. Well done. These 10 phrases are essential tools for intake interviews, general checkups, and any appointment where you need to guide the communication clearly and professionally. Let's have our first question. Which phrase explains that the interpreter will speak in the voice of the patient using I and you? The correct answer is, the interpreter will now interpret everything said in the first person. If you're enjoying the lesson so far, hit the like and subscribe. New medical English content drops every single week. Up next, we're heading into a more intense setting. Phrases for emergencies and urgent care. The doctor needs to ask some quick questions. Please answer briefly if you can.
The doctor needs to ask some quick questions. Please answer briefly if you can. Can you point to where it hurts the most? Can you point to where it hurts the most? Are you having any difficulty breathing? Are you having any difficulty breathing? Have you lost consciousness at any point? Have you lost consciousness at any point? Do you have any chest pain or tightness? Do you have any chest pain or tightness? They're going to check your vital signs now. They're going to check your vital signs now. Please try to stay still. We're going to help you. Please try to stay still. We're going to help you. The doctor is on their way. The doctor is on their way. Can you describe what happened just before you collapsed? Can you describe what happened just before you collapsed? We're preparing you for imaging. Please remain calm. We're preparing you for imaging. Please remain calm. That was certainly a fast-paced section. These are moments when clear professional interpretation matters most. Okay, quiz time. Which phrase would you use when the doctor wants to quickly understand how a patient fainted? The correct answer is, can you describe what happened just before you collapsed? Well done if you got that right. If you're finding this lesson helpful so far, let me know in the comments. Which phrase are you most likely to use first? And don't forget, on student membership, you can download the guide for this lesson or pick it up in my YouTube store for $4.99. Next, let's turn to a critical part of any interpreter's work: supporting patients during procedures and medical interventions. We're going to begin the procedure now. We're going to begin the procedure now. You may feel some pressure, but it shouldn't be painful. You may feel some pressure, but it shouldn't be painful. The nurse is going to insert an IV. It may sting for a moment. The nurse is going to insert an IV. It might sting for a moment. Please lie still while we monitor your heart. Please lie still while we monitor your heart. They're going to numb the area first. They're going to numb the area first. You'll be under general anesthetic. You won't feel or remember anything. You'll be under general anesthetic. You won't feel or remember anything. We need your consent before we can continue. We need your consent before we can continue. Do you have any questions about the procedure? Do you have any questions about the procedure? The procedure is finished. You're in recovery now. The procedure is finished. You're in recovery now. You'll be monitored closely for the next few hours. You'll be monitored closely for the next few hours. Well done. These phrases are the backbone of safe, clear communication during procedures and treatments. Question time. Which phrase explains that the patient will be fully unconscious for surgery? Did you get it right? The correct answer is, you'll be under general anesthetic. You won't feel or remember anything. If you'd like to download all 100 phrases, along with language tips and extra exercises, check out the PDF guide for this lesson. It's really useful for medical interpreters. Now let's move on to one of the most sensitive interpreting environments, mental health and emotional support. Have you been feeling sad, anxious, or overwhelmed lately? Have you been feeling sad, anxious, or overwhelmed lately? How is your sleep? Are you having trouble falling or staying asleep? How is your sleep? Are you having trouble falling or staying asleep? Are you having any thoughts of harming yourself or others? Are you having any thoughts of harming yourself or others? Everything you share is confidential unless there's immediate risk. Everything you share is confidential unless there's immediate risk. Would you like to speak to a therapist or psychologist? Would you like to speak to a therapist or psychologist? You're not alone. There is help available. You're not alone. There is help available. They're here to listen and support you without judgment. They're here to listen and support you without judgment. It's okay to take your time. We can pause anytime. It's okay to take your time. We can pause anytime. Would you like to continue this conversation in a private space? Would you like to continue this conversation in a private space? Let me know if you feel unsafe at any time. Let me know if you feel unsafe at any time. That was a powerful and emotional section, and your role as an interpreter can make a life-changing difference in these moments. Okay, quiz time. Which phrase reminds the patient that everything they say is private unless there's a danger? Did you get it? The correct answer here is, everything you share is confidential unless there's immediate risk. Well done for getting that right. And that is 40 phrases under your belt already. Well done. Now let's move on to topic number 5, physical exams and diagnostics. We're going to look at phrases on how to interpret clearly during these procedures. The doctor is going to listen to your heart and lungs now. The doctor is going to listen to your heart and lungs now. Please take a deep breath in and out. Please take a deep breath in and out. Let me know if you feel any discomfort or pain. Let me know if you feel any discomfort or pain. I'm going to press here. Tell me if it's tender. I'm going to press here. Tell me if it's tender. We're going to take a blood sample now. We're going to take a blood sample now. You might feel a small pinch or sting. You might feel a small pinch or sting. We're sending this to the lab for testing. We're sending this to the lab for testing. Please change into this gown and let us know when you're ready. Please change into this gown and let us know when you're ready. You can close your eyes and try to relax. You can close your eyes and try to relax. We'll explain the results once they're available. We'll explain the results once they're available. Excellent work. These phrases are incredibly useful during routine exams, scans, and sample collection. Which of these phrases explains what happens after a blood test? The correct answer is, we're sending this to the lab for testing. Well done if you got that right. If you're finding this lesson valuable, consider becoming a student member. You'll get the full guide plus 70 additional PDFs from my directory and over 300 exclusive English lessons on my YouTube. Next up is topic 6, talking to family and support people during appointments. Would you like to have someone stay with you during the appointment? Would you like to have someone stay with you during the appointment? Your support person can stay in the room if you feel comfortable. Your support person can stay in the room if you feel comfortable. They're doing well. We're just monitoring them now. They're doing well. We're just monitoring them now. You're welcome to step outside if you need a break. You're welcome to step outside if you need a break. Would you like us to explain what's happening? Would you like us to explain what's happening? We'll give you an update as soon as we can. We'll give you an update as soon as we can. They're going to need some quiet time to recover. They're going to need some quiet time to recover. Please try not to overwhelm them with questions. Please try not to overwhelm them with questions. Do you have any concerns you'd like to address? Do you have any concerns you'd like to address? They're safe, stable, and being looked after. They're safe, stable, and being looked after. Well done. This section helps bridge communication between patients, families, and staff in a respectful, calm way. Quick quiz time. Which phrase gives a soft suggestion to let the patient rest without questions? Did you get it? The correct answer is, please try not to overwhelm them with questions. Well done for getting that right. Coming up is topic 7, phrases used when coordinating with medical teams behind the scenes. Can someone assist me in here, please? Can someone assist me in here, please? Let's quickly review the plan before we begin. Let's quickly review the plan before we begin. Vitals are stable, no changes since the last check. Vitals are stable, no changes since the last check. Could you prepare the meds while I set up the monitor? Could you prepare the meds while I set up the monitor? Patient is alert and responding appropriately. Patient is alert and responding appropriately. Let's debrief afterward to make sure everything's documented. Let's debrief afterward to make sure everything's documented. Can you double check her chart for allergies? Can you double check her chart for allergies? Let's call for the anaesthetist. She's requesting an epidural. Let's call for the anaesthetist. She's requesting an epidural. Do you want to escalate or wait another 10 minutes? Do you want to escalate or wait another 10 minutes? We'll update the family once things have stabilized here. We'll update the family once things have stabilized here. Great job. You are doing so well. These phrases are vital for working behind the scenes with the medical team, where accuracy, tone, and discretion all matter. Which phrase might be used when deciding whether to proceed with the clinical intervention? The correct answer is, do you want to escalate or wait another 10 minutes? Next, let's go into the delivery room, where communication moves fast and every word matters. You're fully dilated. It's time to start pushing. You're fully dilated. It's time to start pushing. Push when you feel the urge. Push when you feel the urge. Take a deep breath and push as hard as you can. Take a deep breath and push as hard as you can. Try to rest between contractions if you can. Try to rest between contractions if you can. I can see the baby's head. You're doing great. I can see the baby's head. You're doing great. Let's try a new position to help things progress. Let's try a new position to help things progress. We need to call the obstetric team now. We need to call the obstetric team now. You might feel burning. That's normal at this stage. You might feel burning. That's normal at this stage. One more big push. The shoulders are next. One more big push. The shoulders are next. The baby is here. You did it. The baby is here. You did it. That was a powerful section. These phrases help guide the most intense moments of life with dignity and calm. If you're looking for more phrases for midwives and maternity care, check out one of my recent lessons. I'll link it on screen and in the video description for you. Now let's have a quick question on these phrases. Which phrase prepares the patient for the sensation of crowning? Did you get it? The correct answer is, you might feel burning. That's normal at this stage. And wow, we're almost at the end. Next up is topic 9. We're turning to postnatal recovery and discharge communication. How are you feeling, physically and emotionally? How are you feeling, physically and emotionally? You may feel cramping. That's the uterus shrinking. You may feel cramping. That's the uterus shrinking. Let me know if you're in any pain so we can manage it. Let me know if you're in any pain so we can manage it. You're doing really well. It's completely normal to feel overwhelmed. You're doing really well. It's completely normal to feel overwhelmed. We'll check your stitches now. It may feel a little uncomfortable. We'll check your stitches now. It may feel a little uncomfortable. Try to rest when the baby is sleeping. Try to rest when the baby is sleeping. Let's talk about feeding options. What are your thoughts? Let's talk about feeding options. What are your thoughts? I'll show you how to hold the baby and I'll guide your hand. I'll show you how to hold the baby and I'll guide your hand. We'll monitor your vitals for the next few hours. We'll monitor your vitals for the next few hours. You'll receive some written information before you go home. You'll receive some written information before you go home. Great work. These phrases support recovery, safety, and confidence as the patient transitions to home care. Which of these phrases is used to help normalize the emotional intensity of the postpartum period? Did you get it? The correct answer is, you're doing really well. It's completely normal to feel overwhelmed. And now for our final topic, topic number 10, comfort, reassurance, and empowerment. These phrases are all about offering supportive empowerment every interpreter should know. You're not alone. We're here to support you. You're not alone. We're here to support you. It's okay to feel nervous. Many people do. It's okay to feel nervous. Many people do. There's no rush. Take your time. There's no rush. Take your time. You're doing more than enough. You're doing more than enough. You don't need to be perfect. Just do your best. You don't need to be perfect. Just do your best. If something doesn't feel right, speak up. If something doesn't feel right, speak up. You're safe here. We're doing everything we can. You're safe here. We're doing everything we can. Every situation is different. There's no right way to feel. Every situation is different. There's no right way to feel. We're with you every step of the way. We're with you every step of the way. You've done something incredible. You've done something incredible. And congratulations! You've just completed 100 phrases for medical interpreters, a full-length masterclass in professional, compassionate and clear communication across a wide range of medical situations. If you found this helpful, don't forget you can download the full PDF guide. The guide contains every phrase from this lesson, and every phrase comes with a language tip and explainer, really good for watching along with the video. The guide also includes a full glossary and additional exercises to really boost your comprehension. It's available right now for student members on the membership tab. Joining student membership with Learning English Pro is great value. For just $4.99 a month, you get access to every PDF guide I've ever made. That's running at 75 professional PDF guides. And with student membership, you'll also gain access to my library of over 300 English lessons. Join membership today, the link is in the video description, and gain access to a whole new world of English learning. Now,